began, continued. This year, the design was for a conference, but pre-conference, we had a high-level stakeholder meeting with stakeholders, health-related stakeholders in Ikotun, Igondo LCD. Mama was present there. So it was a beautiful engagement. And from there, we took it to our pre-assessment stage for our beneficiary. We have most of our beneficiary here seated. They are made to sit at the back, not for segregational purpose, but because of the distinction of, or the distinctiveness of the nature of their kids. Some of these kids, they are sensitive to light, they are sensitive to sound. That's why we are saying they should be away from lighting as much as possible and sound as much as possible. That's why we are there. Please help me to celebrate all of them at the back. They are our mothers, they are our champions, they are people who are making sure these children are not neglected, these children are not cast away. And we are here also to celebrate them. As we do this, I want to take notice of several people that are here. We have with us dignitaries, we have with us mothers, we have with us community leaders, we have with us religious leaders, we have with us different stakeholders. That's why we are building a community with everybody. I will call some names as much as I can to introduce them. We are waiting our guest speakers. We have guest speakers also. As they come, we'll be introducing them. But permit me to introduce the representative of the founder of TKF. The names of the founder is Kalejaye. We always call them Kalejaye family. Ronke Kalejaye and Shegun Kalejaye. And they are heavily represented by their parents. Yeah, we have with us Elder Oyenekon. Please, can he stand up to signify? Father to the founder, representing the founder. Thank you, sir. We also have Elder Kalejaye with us here. Can Daddy stand up? Welcome to our meeting, sir. Welcome, sir. We have Alaja Akinyemi, the Yaloja of Ikotun. God bless you for turning around again. We have several TBA representatives. If you are TBA representative, please can you stand up and be recognized. Thank you for joining us. We have youth representative. Can you stand up wherever you are so that we can recognize you? Youth representative Atere Rafiat, representing the youth of our community. It's going to be an ongoing discussion. Whatsoever we generate here, we passed on to several stakeholders, through the stakeholders to all other people. We are not small. This is the beginning. So we are passing the message across. We have, all right, every religious leader here, please, can we stand up and be recognized? Religious leader, please, a clap for them. Thank you for joining us. Thank you for joining us. I want all of our mothers to stand up a bit so that we can clap for them also. All mothers, all fathers, ably represented. Thank you for all you do. Thank you very much. Thank you very much. As the journey continues, we will continue with our introductions as much. Without wasting our time, I want to invite the country director of Treasure Kids Foundation Nigeria for the welcome speech, Mr. Michael Kayode Ojo. Thank you.
Good morning, sirs. Good morning, ma's. Good morning, our beneficiaries, caregivers, the local government representations, our stakeholders from the top. We really appreciate you, spiritual leaders, the TBAs. In fact, as a matter of fact, we are indeed grateful that we call and you answer. Please, I want to say we are not taking it for granted. We are very, very grateful. Thank you. Aku ìlú tún ṣíṣe o, kò ní dàrú mọ́ wa lórí o. Thank you so much. My welcome speech will be from the founder because they are not here with us, and as a country director, they have sent their note, and that is what I will be duly be saying to us, so that we know that even though they are not here, apart from their daddies that are here, they are also here watching this program live, wherever they are in any part of the world. So it's with great pleasure and anticipation that we welcome you all to Treasure Kids Foundation inaugural conference. Please let us jam our hands for that beautiful word, because this here, we have a lot of representations here that makes this conference a reality. It's also a joy to the life his dream. And I'm saying, how will this thing possible? First, we bat many conferences. This conference marks a significant milestone in the history of Treasure Kids Foundation and the work within. It's a conference of one of its kind in our time. It is a conference to learn from. It's a conference brought together to share ideas as regard this work. This is a kind of conference we come together, share ideas. We are here to learn. Most of us have these cases around us. We don't even know how to handle them. Abájọ́ àwọn mobile ní ìgboro ìmí àwọn òpé wọ́n ṣe ni wọ́n ti fi kan kàn, and all those things. They didn't see the required ìtọ́jú tó yẹ kán rí or the love that they should have because of the wrong stigmatization and sensitization tó ti wà ní community wa. Ìwú ọmọ wo and it's not like that. And this conference is basically to address that, to know that these children too, bí wọ́n ṣe sọ ní Yorùbá pé àkàndá ọmọ, they also have a purpose. The great physicist is just like them. I don't know if we know him very well. He's always on wheelchair. His neck is always like this, and he's one of the greatest physicists in the whole world. It means that if such child is not taken care of, he's going to end up on the street, and we are not going to get whatever outcome or anything that we got from him. And that is why we are in this part of the world. Kò dàbí tàwọn tọ̀hún yẹn. Níbí báyìí kò sí kọ́tà à ń sọ pé ó ṣọmọ, wọ́n fi nǹkan kan ni, wọ́n nà ni, orólé ni, mọ́mí ò jata tó yẹ kó jẹ́ ńgbà tó bí, and many things to attach to it. Ṣùgbọ́n this meeting is coming to say we need to be educated. What could cause it? That is why there is a name to it. Genetics. There is a name pé ìkan tó wá láti inú ẹ̀jẹ̀ ni. Ìgbà míì téèyàn bá lóyún àwọn nǹkan téèyàn ṣe. So that is why this conference is happening, so that we can all learn. Our goal from the beginning has been to create opportunities where individuals with special needs, their families, and professionals within the community can come together to share knowledge, inspire one another, and drive meaningful change, while also providing personalized support and resources to our beneficiary. This is where everybody comes together like this to see how we can champion this cause, how we can help these people in our community, how we can help them in our society, whereby they will not say they are alone. The last Tantani pre-assessment in the last week, most of our daddies here are there. Àwọn ọ̀pọ̀lọpọ̀ bí òmò ọmọ jáde, they are feeling ashamed. The community is not encouraging. The community is not helping. And you see some people, they lock their child in the house for years. Wọ́n kàn máa fún lóúnjẹ àmọ́ wọn ò ní jẹ́ anybody. Ìyá kíní kan ọmọ yín kọ̀ kò sílé. They won't even bring such child out. Those are the things what we want to correct using this conference. That these people, they are part of us. They are part of us. They are part of us as a community, as a society. When you see them, treat them like a child that you have as your own. To bring awareness to conditions that are very rarely talked about, like congenital and genetic disorders. With hope that our education and awareness within the community will help break down these barriers and make our community safe and inclusive for everyone with disabilities, so that we can have a safe community. Today, with the shared voices and experiences of our speakers who knows much about this profession, we have our APES nurse here, we have some people that knows about this profession. They are here. With them and the professionals in the field, caregivers and all that, and everyone here, the parents of these beneficiaries, we hope that we can illuminate the path forward and encourage the people of our immediate community to be active participants in fostering change that values and uplifts every individual. I want to say again that on behalf of the founder, we are saying thank you for joining us on this path of change. God bless us all.
Any MOH, please, ma, can we meet with you? Welcome, ma. Please, a clap, a clap, a clap, a clap. We are not going to be tired with that. Welcome, ma. Thank you for joining us. Thank you for joining us. At this moment, we are going to watch a documentary from our media. The documentary depicts one or more things about this project. So please, let's be patient as we watch the screen.
Thank you for the happiest year of my life. Ooh. Ooh. Happiest year of my life. Thank you for the happiest year of my life. Ooh. Thank you for the happiest year of my life.
So I'm a physiotherapist, special interest in pediatrics. She is my patient and the manager for cerebral palsy. Cerebral palsy in layman language is a series of harm to the brain or insults to the brain or assaults to the brain, either during birth, before birth, or after birth. During here is being managed for CP, as I said earlier, and our goal for her is to equip her with as much skills to be able to thrive among her peers, and this also to equip her with tools to be as independent as possible to do all she needs to do. And also to reduce the burden of care on the parents, caregivers, people around. That's generally what we intend to do for Miss Jolene, and also part of our treatment or management also include patient education. Yeah, patient education is one crucial part of the therapy. Education can be what makes the parent meet the child as a child or a problem. So patient education is very key. Children with special needs need parents who are equipped specially to take care of them. So the parent education is also going to be a huge aspect of this we have, and we hope in the long run.
And this foundation reached out to me as well, came to my place. Thank you so much. I really appreciate. And please, mothers, any which way you can help my child to be able to achieve his goal, to be able to mingle among children, about his education. Before, I'm a selfish person, but I do reach out to my friend and family. I don't know what they call love. I don't know. I don't know. Even though when I'm married to my husband, I don't know what they call her. It's when I have a child. Sometimes my mom will call and be crying that please don't give up on your child. Just keep on trying. And I'm trying. I won't say that I'm tired. I once have a shop. Due to my child condition, I was unable to move further. I just have to pack my things to my house, my instruments, my mixer, my everything. I have to take it to my house because how do I want to be coping with the shop and the child? Physiotherapy, dietitian, pediatric, ENT, and every appointment I must be there. I don't joke with my baby appointment at all because I want the best for him. I would love to start my business. Please, I need your help. My name is Taufikat Mindamola Nasiru. 27 years old and a mother to Jama, living with cerebral palsy. My journey starts from what's it called? Around 2022, around October 27. I was in labor for like 24 hours. And they gave me a drip so that to fasten the baby. Then they gave me the drip. The baby was unable to come.
This conference as we continue. All right, thank you for that. I asked for the full meaning of many things I've been saying, and thank you for bringing it. I have the apex nurse of Ikotun Igondo, if I'm correct, ma'am, or the whole Animocho. Ikotun Igondo here. Please, ma, can you stand up? That's our apex nurse. We have been on the journey together. Mrs. Ajayi, we have been on the journey together. She was there with us while we were doing the pre-assessment. Please help us to thank her. Thank you very much, ma. And we're going to hear a bit from her very soon also. I want to also welcome to our Miss àwọn bàbá wa. So a ní rí wọn láì fi ọ̀wọ̀ tó tọ́ sí wọn wọ̀n wọ́n. Ẹ ṣé gan tí ẹ wà láàrin wa. Thank you very, very much. I Chief Saka Lukman Kosoko, Baale of Omodo Akesan. Please, ẹ bá mi kí wọn káàbọ̀. Thank you. Welcome to this conference. Also, we have Chief Tajuddin Rasak Elemoro of Akesan Kingdom. Welcome, welcome, welcome. Thank you very much. I want to especially greet this doctor. She really helped us to make this happen. It's the MOH of Ikotun Igondo, if I'm correct. Ikotun. I should not do Ikotun Igondo. It's Ikotun. Thank you for that. Dr. Tony Amo, please stand up. Please, a loud ovation for Dr. Tonya. Thank you. Thank you. Thank you. Thank you. All right. Let's continue on this journey together. I'd like to invite the Chief Communication Officer of TKF, Treasure Kid Foundation, to speak vividly and more about this project called Treasure Kids Foundation. Please welcome with me Miss Sarah Akerele. Miss Sarah Akerele. No, I love, you always like removing that one, is Pharmacist Sarah Akerele.
Good morning, everyone. Good morning, distinguished guests present here today. It's an honor to have us join us as we raise a community of change. My name is Sarah Akerele, the Chief Communication Officer of the Treasure Kids Foundation. At the Treasure Kid Foundation, we hold something so dear, and that's that every child is a treasure to be treasured. And for us as an institution, our hearts has found our treasure, our hearts has found our place, and it's with children with congenital and genetic disorder. Treasure Kid Foundation was founded in the year 2023 and was born from the experience and the challenges of the Kalejaye family as caregivers of their medically fragile child, Prince Kalejaye. We are a non-profit organization with a vision of creating inclusive society that promotes improved quality of life for children with congenital and genetic disorders. The pillar of our work rests on 4 major areas. It rests on advocacy and education, it rests on creating awareness, it rests on support, and it rests on building a community. Navigating this journey as an institution has brought us from introducing ourselves to institutions, leveraging on our relationship with the Alimosho General Hospital, meeting with beneficiaries and key stakeholders into this crucial point where we are today, that we are saying that the Treasure Kid Foundation is raising a community of change with one. Having had a number of experiences on the field, and our experiences have ranged from challenges from opportunities, from collaborations that we have met with working on the field, and also from successes with what we have seen from the video we have watched, with beneficiaries achieving milestones. We are saying that we are continuing on this journey to promoting that the world experiences that change, and that change is inclusion for children with congenital and genetic disorder. Today, we are raising a community of change, and that change is nothing without you. That community is nothing without you. And today, we are calling each and every one of us to rise to be a part of that community, of raising a community of change with one, and that one person is you. It is one change, it is one community, but then the effect is what? Is an infinite impact, that when I play my role and you play your role, there's an infinite impact for these children with congenital and genetic disorder. And we are saying that the goal of this annual conference does not just end for today, but moves as we progress in the month and on our journey as the Treasured King Foundation to continue with our stakeholders' engagement on raising awareness, on sharing knowledge and education, and collaboration for children with congenital and genetic disabilities, not just in Nigeria, but in Africa at large and in the world in totality. The conference also has its goal as the empowerment of our parents and our caregivers who are present here, and also for professionals to rise in their capacity of change, that we build a world of change for children with congenital and genetic disorder. And we are also going to be raising practical strategies and solutions and resources towards supporting these children and their family. The conference again is themed what? Raising a community of change with one. It focuses on the power that we all have individually to be that change that we want to see. And so we are calling on each and every one of us present here this morning. Join us in embracing the idea that this change begins with one, and that one person is you. Thank you, and God bless you.
Thank you, Fam Sarah, for that explanation, education on what the Treasure Kids Foundation's project is all about. Please permit me to still welcome. We have several Apex CHOs here. Please permit me not to mention names. We have many of them. Please, if you are Apex CHO, please can you highly stand up so that we can welcome you. Apex CHOs, wherever you are, please. I'm begging everybody to clap. Please clap, clap, clap. Thank you very much for joining us today. Thank you. We have the community development committees. If you are part representing the CDC, please can you stand up so that you can be recognized and welcomed to this conference. I believe I've welcomed the CDA, and now I'm welcoming the CDC, Community Development Committee. If you're part of them, please, thank you, ma. Welcome. Thank you. Thank you. The World Health Committee, if you are here with us, you see we have a lot of representation. We are building a community where everybody is an inclusive community, where every stakeholder is well represented. So if you're part of the World Health Committee, please can you, thank you very much. Please, a clap, a clap, a clap. Thank you for joining us. Thank you for joining us. I have welcomed the TBAs, and we say thank you again for everybody. Like Mr. Michael mentioned earlier, this is not an easy conference to bring every stakeholders together so that we can discuss this issue. It's a peculiar issue that seems neglected among us. These children are kept away from us. They are locked indoor. People don't want to discuss about them. You know what I'm saying? We are grateful for the parents who came out with their words today, and we are very, very glad that they are doing that. We want to, as much as we can, eradicate stigmatization of anybody with any form of disability as much as we can. Thank you very, very much. Thank you. Please, I'm going to also welcome back again to help me with this I want to welcome again Ms. Sarah Akerele to the stage to help with the profile of the first speaker. The first speaker is the founder herself, Mrs. Ronke Kalejaye. She will be speaking on a deliberate topic that concerns us and concerns this project. And I beg us, we are going to be watching through the media, the screen. She's going to be giving a presentation. She's not here with us present, but she's going to give us certain education and advocacy on this journey. Miss Sarah Akerele.
Okay, good morning everyone once again. We'll hear the profile of Mrs. Ronke Kalejaye, the founder of the Treasure Kids Foundation. Mrs. Ronke Kalejaye lived and had some of her university education in Lagos, Nigeria, until her relocation to the United States of America in the year 2007. She continued her education at North Carolina Central University in North Carolina, where she had a degree in psychology and early childhood education, with work history in teaching, human resource management, asset management, and data analysis. Our rich and diverse work experience shows our ability to handle different roles and contribute effectively in various fields. Our membership with the highly respected International Honor Society of Psychology reflects a commitment to academic and professional excellence. Mrs. Ronke Kalejaye and her husband, Mr. Segun Kalejaye, are blessed with 3 adorable children. Outside of business and philanthropic work, Mrs. Ronke focuses on her family affairs and, most importantly, supports her last child, who is medically fragile, with caregiving. A mix of skills and experiences highlights her dedication to making a positive impact in all areas of life and the world at large. So with a round of applause, let us put our hands together as we take the speech of Mrs. Ronke Kalejaye. Thank you.
Hello everyone. Thank you all for coming out today, and thank you for your time. I bring you greetings from Rocklin, California. I would like to especially thank all of the distinguished speakers in the house and also all the professionals that have honored our invitation to be here today. Also, I would like to thank all of Treasured Kids team members for their hard work, their dedication and passion towards the foundation. I appreciate you all. I will be sharing my One Change story with you all. As we all know, the theme of the conference is raising a community of change with one. And I want to share from a perspective of a caregiver, which I am to my son. My son has a disability. He has a condition that is called MTM. It is a very rare condition that affects just one person in about 50,000 people. I would like to share our journey with you all and how we were able to transition from just being a caregiver to now starting a foundation to support other people, other parents and children that have congenital cases. So I got pregnant with my 3rd child, and just like my 2 other pregnancies, everything was fine. Pregnancy was smooth. I didn't have any complication whatsoever during pregnancy. My doctors were not worried for me. The problem started on the day that I gave birth. I gave birth to my boy at exactly 39 weeks, which means it was full term. But as soon as it came out, we realized that it could barely cry, which means that all efforts to cry or all effort to make him cry wasn't very successful. And by the time he eventually cried, his cry was very faint and weak. And so immediately they knew something was wrong. And also, we noticed that he needed help with breathing. His APGAR score was just 1. And so the doctors were so worried. They put him immediately on breathing support. And so they were worried, but they didn't think it was anything major because he looked very healthy, except for that breathing part. And because
And this foundation reached out to me as well, came to my place. Thank you so much. I really appreciate. And please, mothers, any which way you can help my child to be able to achieve his goal, to be able to mingle among children, about his education. Before, I'm a selfish person, but I do reach out to my friends and family. I don't know what they call love. I don't know. I don't know. Even though when I'm married to my husband, I don't know what they call her. It's when I have a child. Sometimes my mom will call and be crying that please don't give up on your child. Just keep on trying. And I'm trying. I won't say that I'm tired. I once have a shop. Due to my child condition, I was unable to move further. I just have to pack my things to my house, my instruments, my mixer, my everything. I have to take it to my house because how do I want to be coping with the shop and the child? Physiotherapy, dietitian, pediatric, ENT, and every appointment I must be there. I don't joke with my baby appointment at all because I want the best for him. I would love to start my business. Please, I need your help. My name is Taufikat Windamala Nasiru. 27 years old and a mother to Jama living with cerebral palsy. My journey starts from what's it called? Around 2022, around October 27. I was in labor for like 24 hours. And they gave me all drip so that to fasten the baby. Then they gave me the drip. The baby was unable to come out. And my pelvic is really, really tight for the baby to come out. Then I was in pain. I can't even breathe properly anymore. And the baby too is really tired. So they have to rush me to General Hospital. They refer me to General Hospital. Is then when we got there, so they have to fasten everything to save me and the baby. When they take me to the theater ward, the doctor was like, "Are you sure this baby is still breathing? Because he can't see any sign of the movement anymore." So I was like, "God, let my baby still be alive." Then they inject me. I slept off. When I woke up, I just have to see my baby face only because I was asking for my baby. They said, "My baby is fine. My baby is fine." So I just saw only the face alone, and then I slept off. They took me to the postnatal ward. Like 2 days, I couldn't see my baby, and I'm seeing some mothers with their baby. "Where is my baby?" I said, "Your baby is fine. Your baby is fine." When my husband came in, I asked him, "Where is my baby?" He said, "Don't worry, the baby is fine." Where is the baby? So later, he told me that the baby is in NNU. My husband said that NNU that is receiving oxygen because the day he came out, he couldn't breathe anymore. That the baby is turning to blue or something. So they have to save the baby. That the baby did not cry, the baby did not do this. I was like, because I can't even touch my baby due to I'm infected already. Said so that the baby too won't be infected. Then they discharged my baby 10 days later. So he used 10 days inside the incubator. Then when they discharge him, so my mom have to take the baby home. I have to stay at the hospital again for like 4 to 5 days. The stress, the everything I went through giving birth to this child, it just make me love my mom more and more because I don't know what they call love before. Then I see that mother are really going through a lot, and I didn't later go to the general hospital to know anything anymore. Then my husband was not telling me that your child have jaundice, but because if you tell me, then I will like, maybe I will not be happy or this and that. I said you should have told me these things before now. He said, yet no, that has a past. So the baby is okay now. Fine, the baby is okay. 3 months, the baby is still okay. Then I was like, okay, my husband, I'm going to, so far I'm strong now. So I have to start my business back because I have a shop and I have people that can take care of my child, I can carry my child. I won't be very tired when I'm at the shop. He said, okay, no problem. If you want to start, you can start. Then I went to my shop. My baby is going to, I think it was around close to 4 months, yes. Close to 4 months. When I went there and someone saw my baby and then CCOing, because that's my company's name. I'm a baker. So like, CCOing, how old is your child? I said 4 months. He said, are you sure this child is 4 months? Like, he's not babying. So we have to take him to Ile Alagbo. I went back to the general hospital and the doctor said, why can't you come back after giving birth to this child? I said, I don't know. I feel the child is okay. He said, you should have come back so that they'll give you more details on the child and what to do. I said, no one told me anything. That when they discharged the child, when he was in NNU, they didn't tell us anything. And my husband did not tell me anything. He said, firstly, the baby was tired when he wanted to give birth to him. When they did the CS, the baby was not crying and the baby was weak, this and that. That the baby really eats his with pelvic when he was inside, so and so forth. That when they pass the oxygen through his nose, that if the baby will have cried, like the oxygen will have circulated the brain, but it did not cry, only circulate the body, not the brain. So the baby is having some challenges. As you're seeing the baby, that the baby is having what they call cerebral palsy, CP. I was like, cerebral palsy. I've not even had that in my life. Like, I don't even know what is CP. I don't even know what is cerebral palsy. The doctor said you have to act fast because the baby is not that, like, the cerebral palsy is not even weakening like that, because there's some cerebral palsy that is worse than this. The thing you have to do, that you have to see the physiotherapy and you have to get some drugs, ZHA, cold olive oil, like that. You have to be using it so to help the brain to make him balance. Then that the baby have jaundice, the baby have this when he was in NNU, this and that. I was just crying. That the doctor said you have to calm down, just follow the procedure, everything will be fine. I said okay, no problem. Then he's still taking formula. Around 4 months, he's still taking formula, buying the formula every day, expenses on expenses. So my husband is getting tired already. Then when I got home, I told my husband this and that. He was like, what is this? Then we can't start the physiotherapy around 4 months because of the money, everything. We get the drugs, and the drugs is able to control some things because we see some changes. Then one of my sis called me that, have you take the child to physiotherapy? I said no. He said you have to take the child to physiotherapy because this thing is not a joking something, that you don't joke with it. I said okay, no problem. So when it was around 5 months going to 6 months, that's when we took him to physiotherapy and we start doing the physiotherapy, using the drugs, and everything is getting better and is changing a lot. A lot of changes is happening. Then he stopped eating. What happened? And the breathing is usually making noise. Then around October, he got admitted. He was affected with pneumonia because we were force feeding him. And meanwhile, I don't know that force feeding can lead to another thing. Then he was having difficulty in breathing, he can't breathe properly, enabilize him to make the breathing proper. He was admitted for like, yes, 11 days. Yes, he was admitted for 11 days. And then when they discharged us, he was okay. And the doctor asked me to see the ENT. I was unable to see the ENT because anytime they gave our appointment, when we tried to see the ENT doctor, they would say that the patient is much more than the doctor, that we have to come the next time. They will give us another appointment. So I was unable to see doctor then. Around December again, my baby got admitted again. Then I was helpless. I was very, very helpless. You can see my child having difficulties in breathing, going through all these things. Like, got admitted again and they nebulized him. He's my first child. I'm unable to walk. I'm unable to do anything because my lifestyle, I work from Monday to Saturday. I do decoration, I do birthday surprises, maybe for your husband.
Before I had him, they thought, oh, maybe it was the epidural. Maybe he took some of the medications. And so they wanted to give it time to see if everything would be normal. However, after about 2 days, they noticed that this wasn't just medication, and we got transferred to a bigger hospital. And that's where the journey began. The journey to find out what was wrong with him. I was discharged after 2 days because I was healthy and they just couldn't keep me there since they're going to continue to watch the baby. My baby was transferred into the intensive care unit at the children's department. They began work on him. They did different blood work and different tests just to find out what was wrong with him. It looked very healthy. It seemed like everything was fine, but there are like problems. So they wanted to find out what these problems, where this problem is coming from. He needed like breathing support. He needed help with swallowing, and so they have to constantly suction saliva out of his mouth because they don't want him to choke on it. He needed a lot of help. He couldn't even feed. He couldn't breastfeed. So they had to find ways to give him some nutrition. They had to pass pipes into his mouth, into his nose, just different things. And so the journey began. They did different tests, and just to cut the long story short, after I don't know hundreds of tests, they came back. They pulled a muscle from him to test it, and so after pulling the muscle, they did another test. In combination with those two, they came to a conclusion that he has a very rare condition that is called myotubular myopathy. It is a neuromuscular disease. It is a disease that affects the muscle, pretty much all of the muscles in the body. They told us that this disease came about because there's a lack of protein in the body. Either there's a lack of it or there's a deficient. It's not enough in the body. And so the protein is called myotubularin, and so that's why Prince has that condition. My son is Prince. That's why he has the condition. And so after lots of meetings and just constant sitting with the doctors and brainstorming, and just lots of research on their part, they came back and decided that they were going to give him a tracheostomy. Now, in my entire life, I've never heard about tracheostomy before, but they showed me an example of what it was, and they told me that for the long run, this is what Prince would need. And so they believe that it is best for them to give it to him from the hospital so that they can send us home with all of the supplies that we need so that Prince can be safe. Because if he's needing help with breathing, they doubt that it's best to send him home without putting that in place. And so after a little bit of research on my part, I also found that that was a thing with the MTM community. And so we had a talk, we had a conversation with my family, my husband, and we decided that let's do it, let's keep the baby safe. And so we did it. We consented to it. As a matter of fact, they gave us other options, but that was the only option that would work at that time. for us. And so we did the surgery, and because he also has trouble swallowing, they put a G-tube in place for him, and the G-tube is where it's like a placement, a little button in his stomach, so that he can be able to eat through that. Because eating by mouth is not very safe for him, since he has trouble swallowing. And so we spent 5 months total in the hospital, and then we came home. Now, that was just a brief summary of what happened, how we came about his diagnosis. However, there was a lot happening outside of the hospital with the family, because this happened to be something new to us. We've never had to experience such a huge change in our life, it was a hurt, Imagine having to, expecting a baby, everything seemed to be fine, going on fine, pregnancy was healthy, and then you were faced with a shocking news that your child has a long term. This is not, the doctors didn't tell us that this will go away in 5 days or 2 weeks. As a matter of fact, they didn't give any ounce of hope. They literally, the way that they worded it, it's almost like, take the baby home and wait for the baby to just wait and see what happens, because the life expectancy for this particular disease or condition is just 2 years. As a matter of fact, a lot of people, majority of children, never make it out of the hospital with this condition. And so there was a lot going through our mind, a lot. Number one, just being a Nigerian and having to come home from the hospital without your child, having to go through the naming ceremony day without having an event, just having people call you and say congratulations, but they can't even come to the house to visit you because the baby is not in the house. That was a lot of children, having to take daily trips to the hospital to be there for my child, having to see all of the tubings that they were putting through him and, through his mouth, through his nose, sometimes just with the injection, sometimes because they cannot find vein, they have to go through his head, sometimes they have to go through his feet, all the things that I've never been exposed to in my life, constant, what's it called, in the hospital, just the beepings and the, all the medical, equipment going off, because you're in a room with other, fragile babies, and just a lot there was a lot going on that I didn't think I could deal with. I spent a lot of those times crying. I spent a lot of my time just overthinking and just wondering how or why this happened to me. Why my family? I just couldn't wrap my head around it. I was like, God, we were praying, we prayed during the pregnancy, we were hoping for the best. Myself and my husband, we wanted this to be our last child, have this. We already said that, after this child, all we wanted to do was travel the world. How are we supposed to do all this now, I mean, it was a lot. There were days where when I pumped for him, my heart just ached a lot, There's a particular day that I experienced heart palpitation. I've been hearing that before, but I never knew what it was. But when I experienced it, I thought that was all for me. My heart would not stop, and I was holding on to it so dearly. I kept holding on to it. My husband was so scared for me that he wanted to call emergency, 911, so that I could get help. And this was all because something unexpected happened. There were so many things going through my head. I was like, what did I do wrong? Did I visit a place that I wasn't supposed to visit? Did somebody did something to hurt me? Is someone not happy about me? Just so many things were going through my mind. I didn't think it was normal. I didn't think it was natural, as a typical Nigerian. I didn't think it was natural. And so I just kept praying. It's difficult, to pray when you have so much going on. All of your prayers is filled with tears. There are days where all I want to do is just cry and just cry and just overthink. I lost so much weight in the process. Like within a couple of months, I lost ridiculous amount of weight, and so it was just unbearable for me. The news was too heavy for me to bear. I felt like the weight of the world was on my shoulder. The world was moving on. Everybody around me, they moved on pretty quick. They had to go to their workplace. Things were moving on pretty fast, and I, on the other hand, could not return back to work. I took time off of work to have my baby, and I couldn't return back to work because when they discharged us, they told us his care was 24 hours, which means you cannot take an eye off of him because he's coming home with a ventilator, and ventilator is pretty much life support. He's coming home with lots and lots of equipment, so it's just like bringing. Is part of the section that he has in the hospital, bringing everything home and setting him up at home. And so it just was a lot. Just dealing with it was a lot. My husband I don't know how he did it. He was the strongest one for the family. We went through it. We went through it. We brought him home and we did what we needed to do. They trained us before we came home. The hospital trained us. We had days where we were at the hospital consistently. We slept there just so that they can teach us everything that we need to know with him. And so we came home, and that's where things began to change. Things began to change because after we came home and we got comfortable with Prince's care, we realized that, okay, this is our new normal. I find out that thinking so much and just littering around, just crying and wondering why me, why my family wasn't helping so much. I have a beautiful baby here that I can spend my time with and love on. And so that's where things began to change. I started to learn how to take care of him, started to watch him grow little by little. All the things that were difficult for him to do while he was very young, he started to do them little by little, because now he has the support of the trach, which means he's not using all of his strength to breathe anymore. He's getting the support from that machine, and so he can raise his hand, he can raise his legs, things that were very difficult. Usually a typical baby would smile very early. Smiling was a lot for Prince. When he began to smile, it was a thing of joy for us. Just little by little, he started to hit some milestone, and so we began to celebrate those little victories, and so things began to change just mentally as well, because I went through so much that I wondered if I'm in the United States of America and I have this much of professionals working with me on Prince's case, reassuring me that they will do their best to keep him and keep him stable, keep him alive, to their best, and I personally still went through so much heartache, so much, anxiety. I couldn't sleep anymore. When I sleep, I would just wake up. When I try to sleep, I would dream of something and I would just wake up. I would think of my son and I would just wake up. I couldn't sleep anymore. I had phone anxiety. I kept, paying so much attention to my phone, hoping that somebody, that they will call, because they've called so much with so many bad news that I got so used to it. So every time I just kept checking my phone. Even when I'm not with him, I'm checking my phone. When I'm with him, I try to be there with him, but in my heart of hearts, I wish that this wasn't happening to my son. And so I wondered if I, as a person living in the United States, having all the support that I need, went through this much heartache, what is happening to people with kids like this in Nigeria? Some of the support that I received at the hospital opened my eyes a lot. At the hospital, we had meetings, like a whole conference meeting with all the doctors whenever there's a new information they needed to pass on to us. And so what we did was we invited a doctor friend to come in the meeting with us. That way they can help us listen carefully, so that if there's anything that we're not understanding, if there's anything that we are missing out, they can help us. They can be like a mouthpiece for the family. Also, the hospital had someone in place that is a patient advocate that was in the meeting or just in the hospital generally, specifically assigned for my family, to make sure that we have all that we need, to make sure that the doctors are treating us right. So the lady would be in the meeting with us, would take notes on my behalf, would be there to make sure that we have all the support that we need. We will raise questions to make sure that this family will be well taken care of. Outside of the meetings, she would visit and make sure that we have things in place. Helped me collaborate with insurance to make sure that we have nursing hours, so that when Prince goes home, she can have a nurse to relieve me and also to help care for him. Just so many things. She worked to help sure that I have a company that can provide all the nursing, the medical supplies that we need for Prince through his insurance. I mean, they made everything so easy for me. And so I was wondering, is there something like this in Nigeria? Because even though I had all of these things, I still went through so much mentally. I was depressed for a long time. I was depressed. And so I wondered, are there people in place for people in Nigeria that are going through this, to help, at least help relieve? Imagine if I was going through so much mentally like that, and I had to be the one to make sure things were in order while in the hospital. I think that would have messed me up, because even I tried to commit suicide. I tried to literally hurt myself. The situation was too much for me to bear, that I thought if I removed myself from the situation, maybe it would be fine. Maybe I would be relieved a little bit. As a matter of fact, I planned it so well that I didn't want my kids to resent me if I hurt myself. So I wanted it to be in the case of like an accident, so that, they will blame it on the accident and not say that, oh, mommy did this to herself. That was how bad it was. And so because I went through this much, I wanted to reach out to people in Nigeria. Or I wanted to at least, I think the initial thought was to at least find out if there are things in place for people that are going through stuff like this in Nigeria. It is already worse that you have a child and the child has a disability. And then come to now think of it that you are by yourself and you don't have any support. I just cannot understand that. And so I started to do a lot of research, trying to see, what's happening in Nigeria, are there things in place for if people have kids with disability and stuff like that. And I didn't find any information. As a matter of fact, I was like, okay, maybe, Nigeria things, that things are not very, documented. So maybe there will be like foundations that are caring for people like this and stuff like that. And I found very limited information. I found that there's a lot of people or a lot of foundations that are geared towards people with cerebral palsy or autism or, the deaf and the blind. But there are some rare cases, rare situations like mine. Is anybody seeing them? Is anybody paying attention to them? And that is where the thought of starting the foundation started. It started because I didn't find anybody doing it. I wanted to, reach out and partner up with whoever already has something going on. I was willing to just reach out and partner with them. But that wasn't the case. And so because I didn't find that, I decided, okay, let me go ahead and start this. It was so much heavy on my heart that every time that something new happens for Prince, maybe it gets a new stroller, I think about, okay, is there anybody doing this? Do people in Nigeria have stroller? Are they provided with the support that they need? And so I figured, okay, maybe this is something that I need to start. As a matter of fact, if I think too deeply into it, I think I wouldn't have done it because, for one, my house was became a one-income household. I had to stop my job. And so it wasn't like there was money that needed to be, that was sitting around. It was just, let's start something. Even if it is just to listen to them. Because when I came out of the hospital, I started to do research. I wanted to find out, is there anybody near me that has a child with this condition, or at least around, that I can see how their child is doing, that I can hear from them. Luckily enough, I found some connections on Facebook. I found some connections online. And as a matter of fact, they hosted a conference. Prince was just a few months old, and we went there. We went to the conference, and that kind of helped me a little bit. It helped me because I saw kids, and I saw how they've progressed. I saw them, even though the situation at the beginning didn't look very promising. Some people made it, and some people are making it. Some of them are in college, some of them, I saw them and they're doing fine. Even though they had pretty visible disability, they were doing fine in their own way. And so that kind of encouraged me. And so I wanted to be there for the Nigerian community, because I was like, if this had happened to Prince in Nigeria, what would I have loved? Would I have loved to have the same experience that I have here? If this had happened in Nigeria, would Prince have survived it? If this had happened in Nigeria, what would my mental state be like? Would I have been accepted by the community? We all know how there's a lot of stigma around disabilities in Nigeria. As a matter of fact, some of the thoughts that came into my mind, I feel like the reason that I had so much hard time getting over my son's diagnosis is because I am a typical Nigerian. I am a Nigerian that have seen a lot of how people were treated because they had disability before I came to the United States. And so those things messed with me. Maybe I thought that that's the same way that I would be treated here. It messed with me so much. I remember, I cannot forget the case of how people with disability will come into the bus and people would literally alight from the bus because they don't want their disability to rub off on them. Just a lot of ignorance around disability. And so I'm like, this has got to change. It is already enough that these people are met with an unexpected situation. It is already enough. Nobody should make them feel less. Nobody should add more to this burden. Nobody. It sounded like something very huge, something very unachievable. But I'm like, at least let it start. Let it start with one person. Let it start. Because even here in the US, it's not like, there are not shortcomings around or things are not happening. But majority of the time, if you can advocate for yourself, if you can advocate for your child, things will go the way they're supposed to. There's a lot of stigma in Nigeria. There are no accommodations, the roads are not accessible. A lot of people that would do well by just owning a wheelchair in Nigeria, they don't have a wheelchair. And so they have to go around whatever means, even if it means rubbing themselves on the floor. Something as little as wheelchair. There's a lot of children in Nigeria. I'm going to say this term in Yoruba. Somebody that cannot swallow their secretion or have a hard time swallowing their secretion. Nigerians will be abusing them and say, Ajato, oti jato, oti shekiniko. But in reality, if there's something called a suctioning machine, there will not be a need to jato because you can literally help them suction it out. But we don't know these things. We don't know these things. And so I wanted to, some of the experience that I got here, some of the treatment that I got here, I want to see if maybe we can bring it to Nigeria and emulate some of it. I wanted to see if my team, if I create a team, if they can be there for parents at the hospital when they get this diagnosis. I remember, how when we watch Nigerian movie, when somebody dies, the doctor just tell it to you in the hallway and that's it. And you'll be crying in the hallway, rubbing yourself on the floor. That's it. Imagine if this is how I was treated here. In my own case, we had conference room, holding meetings, like it was, serious, professionally. So, even though that's just a very minimal thing, but still, I want to see if we can create a team that can be there to support those parents. To support them during that phase in the hospital when they can, I wasn't listening when they were having those meetings, I was just crying. There are times when my patient advocate would ask the doctors to give me a few minutes to put myself together, and the doctors will step out and they'll come back in again and start the conversation again. Imagine if I can be that patient advocate for these parents in Nigeria, just standing in the gap for their interest at the time that they are very vulnerable. I wonder if I could help educate their family. Again, we've seen a lot of situations where when a child is born with disability in Nigeria, the family immediately turn their back against this woman, starting from the husband. Would say, oh, where did you bring this child from? This is not my child. And so a lot of marriages would not even survive it. It is a lot, especially on the mother of the child. So we want to see if we can be that person or be that team that can let that woman know that she is not alone. Let that family know that this is not this woman's fault. Help educate them. Provide resources to them to help them with their condition, help them with their current situation, help the child. Just thinking about it in my own or in any human reasoning, I I'm not in the best situation or in the best condition to have even started something like this because I don't have the time. When I think time, I think luxury because all of my time is being used to care for my son, to keep him alive. I barely sleep at night because, like I said, we have a whole hospital set up in his room, which means alarm is going off here and here. You know all the alarms, the post socks that makes all the alarms. My child can need suctioning at any time. His trach can be dislocated at any time. So literally my eyes cannot be off of him. I literally live without without sleep. And so my little time that I have, I shouldn't even be investing it in something like this. Or the little money that my family has, we can't be everywhere like we used to be. We're not supposed to. I feel like we weren't in the, in a normal human reasoning, we're not in the best position to start to say, okay, I want to reach out to other people. But when you think about it again, you know how they say there is always purpose in pain. That was the situation for us. We felt the pain so much that we don't want any other person to feel this pain without support. The worst thing that can happen to someone is to go through something very a very trying time without having the support. To go through it alone, it is not something I wish on my enemy. And so I wanted to be there, just letting someone know that, okay, you are not alone. Look at me. Look at my family. This is happening to us too. It took me some months before I had the courage, after Prince was born, to make a post, to put a picture out about him. I had to come to the conclusion that if I had posted a picture about my first child and you click and like it and supported it, I post the same about my second child and you clicked and like and supported it all these years, my third child is also coming on your screen. I don't care what you think about it. The same way that you've been looking and admiring my other two kids, you're going to look and admire this one too. And also, if those people that I looked up on the internet and I get support from them, they didn't know me from anywhere, they didn't even know that I would have a child with disability or with the same condition, but they put a lot of information out. These are the information that are helping me with my own child now. Imagine if they have withheld those information. Where would I have gone for support? Because if there's anything wrong with Prince, I can go on that group and type. Maybe if Prince is having difficulty sleeping, I can go on that group and type and see if there is any of those boys, because the condition only affects boys. The X-linked condition only affects boys. And so, if Prince is having any difficulty and I go on there and put it there, I found results. If they've used any particular medicine, I found it there. If their boys are having certain, it just helped to be able to know that there is somewhere that you can go for information. When I go to the doctor's office and I am talking so confidently about my child, they wonder, how did you know these things? Because there are resources out there. Imagine those people if they've withheld those resources and didn't put it online for everybody. And so that's what I thought about that. Prince's case, I'm going to make sure that I spread about him, that way people, especially my Nigerian community, can know that, okay, if they ever have a child with myotubular myopathy or any other rare condition, just know that you are not alone. A Nigerian has also experienced it. And I know there are a lot of Nigerians out there that are having these difficulties or that have disabilities like this that are very rare, but nobody is talking about it, and so they just are confided in their own space. They're siloed to the four corners of their house because nobody will accept them outside. People would badmouth them outside. There's a lot of ignorance around disability in Nigeria. And so if you allow it, people will treat you unfairly and will treat your child unkindly. And so you be that one person that speaks up for your child and advocate for your child. If it requires you educating the people around you and educating them about the condition and also telling them how you want your child to be treated, you do just that. And before you know it, the message would continue to spread. There's a lot of changes that the government needs to make when it comes to the disabled community. However, I feel like these changes may probably come quickly if we have people that continues to speak and advocate for this community. If there's nobody already doing it around you, you be that one person that starts the conversation. If there are already people doing it, how about you join them? Because just by one person's action, if one person can start a conversation, it could lead to other conversations. I believe that as caregivers, we already have the license to start these conversations. We have the first-hand experience compared to any other person. And so we can initiate these conversations. I just want to encourage you all that conversations that we start today can create ripple effects that would affect and transform our community in the long run. Just a decision that you make today to speak out for this community, to speak out for your child, can lead to something huge and positive in our community and our nation as a whole. I just want you all to know, to be encouraged, and to know that you're not alone. I have high respect for you as a caregiver because I understand and I am in the same situation. I see you. I appreciate your bravery, your compassion and empathy, and all of the hard work that you put in to support your child. I am sure your child appreciates it as well. And I pray that all your efforts will not go to waste. I pray that you would always have reasons to smile and be very hopeful. Thank you, and again, thank you for your time today.
So we want to continue in order not to waste much of our time here, but we believe with time the light will be restored back. So thank you very much. Please, a round of applause for Mrs. Oluronke Kalejaye for that beautiful change story that we've all had. And I believe with this, every one of us, we've learned one or two things. That the major reason why we are here today is to raise a community of change with one. And that change begins with you and I. And I believe we are here to make that change to happen. Yes or no? If you are here to make that change happen, say yes. So that will now lead us to, when I say this, you will give a response. And I believe that is the slogan of this conference. If I say raising a community of change with one, your own response will be one change, one community, infinite impact. Can we get that? We have it at the front page of this conference handbook. So we are using that slogan throughout this conference today. So raising a community of change with one. I can see here that it's only the men that are saying something. Oh. Women, I believe we can make that change as well. And I believe we are here also. Raising a community of change with one. One change, one community, infinite impact. A round of applause for ourselves, please. Thank you very much. Permit me to recognize the presence of some people in our midst. Here we have our dear MOH, Directorate of all MOHs in Alimosho local government. My Oga, with a standing ovation, we recognize your presence, ma. Dr. Abimbola Adekoya, you are highly welcome, ma. That is the medical officer of health for Alimosho local government. And also we have in our midst, and it's also a guest speaker in this conference, the head of department pediatric Alimosho General Hospital, in person of Dr. Temitope Adegboyega. You are highly welcome, sir. You are welcome. Please, can you stand up for recognition, sir? You are highly welcome, sir. Likewise, we have here one of the distinguished stakeholders, CDC General Secretary, a man with many caps. I do call him a man with many caps. He is the CDC General Secretary, also doubles the World Health Committee Alliance Chairman, and also one of the ambassadors of this Treasure Keys Foundation. Permit me to recognize the presence of our Elder Ademola Oshibelu. You are highly welcome, sir. Now, moving forward, we are on item number 13. In order not to waste much of our time, we want to hear from our guest speaker, navigating prevention, early diagnosis, and intervention for congenital. And this will be done by no any other person than our head of department for pediatric in Alimosho local government, Dr. Temitope Adegboyega. You are welcome to the podium.
Good afternoon, everybody. Ẹ kú ilé o, ẹ̀yin ará. Àmìmà, òyìnbó la máa fi sọ, ṣùgbọ́n nígbà míì a tún fi Yorùbá díẹ̀ sí fún àǹfààní àwọn màmá wa àtàwọn bàbá wa tó wà níbí báyìí. So nǹkan tó ní sọ̀rọ̀ lé lórí, what I'm asked to talk about is actually navigating prevention, early diagnosis and intervention for congenital malformations. So nǹkan tó ń sọ ní pé báwo la ṣe lè díwọ̀n ọ́ dí àwọn kìíní àwọn àìsàn yìí kù. Báwo la ṣe lè tètè mọ̀ pé àwọn ọmọ wa wọ́n ní àwọn àìsàn yìí so that wọ́n á lè gba ìlera tó tó. So navigating prevention. We are all going to contribute because I don't want to stand there and keep on talking and talking and talking. You all have different experiences. So I would like to hear from you too. So when we talk about congenital anomaly or congenital malformation, tá bá sọ pé ọmọ kan ò ṣe dáadáa, nígbà míì gan a máa ní láti tì wọ́n mọ́nú ilé so that àwọn ará àta wọn ò ní rí nǹkan tó ń ṣẹlẹ̀ nínú ilé wa. Báwọn Yorùbá ṣe máa ń sọ wá ní inú ilé ẹni la ti ń jẹ òkété onídodo, àní jẹ́ kẹ́lòmíì mọ̀ ń pa ẹ̀. Kí ló máa ń fà á? For all of us that are born, two things actually affect us as human beings: nature and nurture. Nature is the way we are born. Nurture are the things that happens in our environment. Àwọn Yorùbá sọ ń gbà mí pé bá ti bí ni kọ́ là ń rí, àbí báwo la ṣe máa ń sọ. Àwọn nǹkan tó máa ń fà á táwọn a máa fi ní àwọn àìsàn bíi ní bó ṣe bí wa, báwo la ṣe tọ́jú ara wa. Àwọn nǹkan kan a lè yí wọn padà, àwọn nǹkan kan ó ní nǹkan tá a lè ṣe ń pa wọn. So if we are talking about congenital malformation, you talk about, okay, some of them are inherited. A child is born with them because of the gene the child was able to get or acquire from the parents. And some of them are not acquired at all. But during the process of care for the child to be born, some things happen. So we have children that have infection from the womb. Children that maybe they didn't go for antenatal, they were not taking the medication they are supposed to take, they didn't deliver where they are supposed to deliver the child. So that child may not cry immediately after birth, what we call in our field severe perinatal asphyxia. Màá tún fẹ́ sọ ní Yorùbá nítorí pé tó bá bí àwọn èèyàn sínú ayé yìí bá ṣe sọ tẹ́lẹ̀, ìgbà míì àìsàn yẹn lè jẹ́ pé nǹkan tó bí wa mọ́, kò sí nǹkan tá a lè ṣe ń pa yẹn. Àpẹẹrẹ ni ọmọ tí alàgbà obìnrin tó ń sọ̀rọ̀ nípa ọmọ wọn, kò sí nǹkan tó lè ṣe ń pa yẹn. Nǹkan tó gbà nípa tábà bímọ kò ṣáà ní jọ ẹlòmíì, nǹkan tó bá gbà lọ́wọ́ bàbá àtìyá bẹ́ẹ̀ náà lọmọ náà ṣe máa ń rí. Bàbá àtìyá lè máa ní o, kó jẹ́ pé ọmọ yẹn ló máa ní. So nǹkan tá a gbà lọ́wọ́ àwọn òbí wa ni, kò sí nǹkan tá a lè ṣe sí yẹn. But àwọn nǹkan míì tá a bá gba ìtọ́jú dáadáa lọ́wọ́ àwọn tó ń tọ́jú wa, tó jẹ́ pé ńgbà míì tá a bá máa fi bímọ, àgbà àwọn imatinis, àwọn oògùn tó yẹ ká gbà, àwọn ọmọ míì gan bóyá ilé lọ bí wọn sí, ó kọ̀ dàbí pọ́kọ̀ jábọ́ ni. Ìgbà míì ó máa ń disturb orí wọn, brain wọn, tó jẹ́ pé kò ní ṣe dáa, wọ́n lè má ké ńgbà tá a bá bí wọn tán. So going back, Some of these things may be like a congenital infection. Some of them may be jaundice, when a child is born and the child has jaundice. And parents sometimes listen to their friend as, mama alágbájá, nígbà tí mo bímọ tèmi tọ́ ló ní jaundice, antibiotics lọ fún wa lọ́spítù, ìwọ náà lọ ra antibiotics. Kò ń ṣe gbogbo jaundice ọ̀kánjú yellow, kára yellow ni antibiotics máa ń gbọ́. Oríṣiríṣi nǹkan ló lè fa jaundice yẹn. Ó lè jẹ́ pé ìgbà míì irú ẹ̀jẹ̀ tí màmá ní tó yàtọ̀ sí tọmọ ó lè fà á. Sórí yẹn àbá lo antibiotics látẹ̀lé títí dọdún tó ń bọ̀, kò sí nǹkan tí antibiotics máa ṣe sí o. Nígbà míì àwọn ará wa wá sọ pé a máa lo igi pọ̀pọ́. Pé ó máa ń ṣiṣẹ́ o. But èmi ò ń ṣe àwọn tó máa ń tọ́jú èèyàn ní tìbílẹ̀. Bọ̀ǹkan tí mo mọ̀ ní pé ó lè má ṣiṣẹ́ dáadáa tó. Because nígbà míì when the jaundice level is so high, even the photo light will not be sufficient. We need to change the blood. And sometimes if it's much, we may need to change the blood like twice or thrice. And tá a bá ṣe dáadáa, jaundice yẹn máa ń wọnú agbárí wọn. Tó bá dẹ̀ wọnú agbárí wọn ò ní ṣe dáadáa tó. So ẹni tó lóyún fún oṣù mẹ́sàn-án, kí ló dé tó jẹ́ pé lẹ́yìn oṣù mẹ́sàn-án tọ́mọ bá wá bẹ̀rẹ̀ sí dàgbà? Ṣé mo pé àwọn ọmọ yẹn nígbà tá a bá bí wọn, wọn ń dàgbà lọ títí, wọn ń ṣe dáadáa lọ títí, a lè mọ̀ bí wọ́n máa gbọ́rùn dúró àbí bí wọ́n máa lè jókòó, because kò tí ì tó àkókò láti gbọ́rùn dúró àbí láti jókòó. Àbí ṣé kò ní yà yín lẹ́nu tẹ́ bá bímọ lọ́jọ́ kan kọ́mọ ẹ̀dẹ́bẹ̀ sí rìn ní sitting room ẹ̀yin gan sá lọ ẹni wọ́n ọmọ òlélẹ̀. So à ń tètè mọ̀ nǹkan tó ń ṣẹlẹ̀. Wọ́n á kọ́ máa ké ni wọ́n á dẹ̀ máa jẹun tára wọn bá ti yá tán, but nǹkan tó ti da ọpọlọ láàmú tó bá bẹ̀rẹ̀ sí tó àkókò láti jẹ́ pé gbọ́rùn dúró, ẹ wá máa rí pé wọn ò gbọ́rùn dúró. Tó bá bẹ̀rẹ̀ sí tó àkókò láti jókòó, a rí pé wọn ò lè jókòó. Tó bá tó àkókò láti dúró láti máa rìn, wọ́n lè máa rìn. Ìgbà míì gan a rí pé ó dàbí orí wọn kéré ju tàwọn ọmọ míì lọ. Ìyẹn sọ fún wa ní pé wàhálà wà o. So nítorí ẹ̀ là ṣe ń tètè mọ àwọn ọmọ ìyá mi wá, ọmọ yẹn kò ṣe dáadáa but ó ti ń kéńsìn o, ó ti ń jẹun, kò tán síbẹ̀ o. Nítorí ẹ̀ ni àwa tá a bá ń tọ́jú àwọn ọmọdé, irú àwọn ọmọ bẹ́ẹ̀ a máa wò wọ́n títí dọdún kan ká bá lè wo nǹkan tó máa ṣẹlẹ̀. But tá a bá ní ká máa wọ ọmọ fọ́dún kan máa oúnjẹ oúnjẹun kí àwọn dọ́tọ̀ yẹn láì láti máa gbó wa o. Èmi ò ṣiṣẹ́ ní private hospital, so owó tẹ́yàn bá san kò ń wọ àpò tèmi, àpò hospital ló ń wọ. So wípé màá ní kán wá fọ́dún kan yẹn kò ń ṣàpò mi lówó yẹn ń wọ̀. So kí là ń sọ? Nǹkan tá à ń sọ ni pé ìgbà míì àwọn ọmọ míì ara wọn á máa gbóná ńgbà tó bá bí wọn. I hope I don't have too much of English speaker here so that okay, so that ara wọn lè máa gbóná kó wá ní meningitis. Ìyẹn náà lè affect ọpọlọ wọn. Ìgbà míì wọn ò ní ṣe dáadáa, especially tó o bá tí ìpọ̀ ọmọ ọdún méjì. So wọ́n lè ní nǹkan tá a máa ń pè ní, àwọn míì á pè ní delayed developmental milestone. Àwa tá a bá fẹ́ pè dáadáa ní èdè àwọn dọ́tọ̀ ọmọdé, a ní ẹni cerebral palsy, tó túmọ̀ yìí pé jàǹbá kan ṣẹlẹ̀ kí ọpọlọ ọmọ ẹ tó dàgbà kó tó develop tó ti affect ọpọlọ yẹ o. So ó máa ń ṣẹlẹ̀ láwọn ọmọ tá a bá bí títí dé kó tó dọdún méjì irú nǹkan bẹ́ẹ̀ lè ṣẹlẹ̀ kan ní cerebral palsy. àwọn àìsàn míì dẹ̀kẹ̀rẹ̀ oríṣiríṣi ni wọ́n mo rí àwọn kan ní ìlú àwọn the Gulf countries because bó ṣiṣẹ́ díẹ̀ ní UAE ní Dubai kí n tó tún padà wá sí Nàìjíríà a dẹ̀ rí pé láàrin wọn wọ́n máa ń fẹ́ ara wọn téèyàn bá dẹ̀ ń fẹ́ ara èèyàn a máa ń pè ní we call it disease that have to do with consanguinity, that is blood relation. Bí kí ọmọ yín kó fẹ́ ọmọ àbúrò yín. So àwọn kìíní yẹn máa ń ràn family bẹ́ẹ̀ a máa ń pè wọ́n ní autosomal recessive disorders. Then yẹn náà tún máa ń fà kó máa ṣe dáadáa. Sẹ́rí pé mo ti fi oríṣiríṣi nǹkan lélẹ̀ àwọn ìyá mi wọ́n ní bíi syphilis nítorí ẹ̀tọ́ bá lọ sí hospital a máa ní kó ṣe test syphilis ọkọ ní rubella ó máa ń jẹ́ kórí àwọn ọmọ kéré oríṣiríṣi nǹkan ló lè ṣẹlẹ̀ àwọn ọmọ mi ìdẹ̀kẹ̀rẹ̀ tó ò bá gbàtọ́jú dáadáa wọ́n lè ní hydrocephalus kó ní wọ́n tóbi tábàdé UCH àríbì kan tó máa ń pè ní wọ́ọ̀dì àwọn aládé orí wọ́ọ̀dì àwọn aládé orí túmọ̀ sí wọ́ọ̀dì àwọn ọmọ tó jẹ́ pé orí wọn tóbi bàǹbàǹbà ìnà irú àwọn èèyàn bẹ́ẹ̀ yẹn ńgbà míì wọ́n á fẹ́ tì wọ́n sílé káwọn ará àta má bàa rí wọn kí là ń sọ̀rọ̀ ń pa ó túmọ̀ pé a ní láti gba àwọn àìsàn mo dẹ̀ mọ̀ pé gbogbo wa ní alàgbà nínú ìtọ́jú àwọn ọmọ àti àwọn èèyàn so èmi gan mọ̀ tán o so díẹ̀ tá a mọ̀ mo ní ìgbàgbọ́ pé a tún padà lọ sí ìletò wa láti tún ran àwọn èèyàn wa lọ́wọ́ so that tó bá máa yá kò ní ṣe pé àwọn olórí wa tẹ́ bá wò tá ń sìn ẹ́ rí pé àwọn ọmọ tó màmá wọn lè máa gbé wọn lọ sí skul kọ́ máa ṣe dáadáa kọ́ máa ìbẹ́ yẹn wọ́n dẹ̀ pọ̀ ń ta ń sìn yín because nígbà míì nítorí àmọ́ ṣe máa ń bá àwọn dókítà ẹgbẹ́ mi jà nígbà míì tó bá wà ní ONG pé ẹni yìí ó book sọ́dọ̀ yín kí lẹ ṣe sí tó jẹ́ pé orí ẹ̀ rí báyìí tó jẹ́ pé kò kí dáadáa kí lẹ ń wò because wàhálà ní fòbí téèyàn bá bímọ ó máa ń retí pé ọmọ ìyẹn tó bá dé stage kan á lè tọ́jú òun kò ń ṣe pé ká tọ́jú ara wa ká tọ́jú ọmọ ká tún tọ́jú ọmọ títí dọjọ́ ogbó kò ń ṣe nǹkan tóbi ń wá nìyẹn pọ̀ táwọn àìsàn yẹn bá kọlù wọ́n wọn ò ní lè rọra wọn lọ́wọ́ kò dàbí ìlú òyìnbó bó ṣe sọ tó ní àwọn oríṣiríṣi support nǹkan tó lè ṣe fún wọn tẹ́ ẹ̀ bá tẹ̀ fẹ́ gan àwọn institution kan lè gbà wọ́n lọ́wọ́ yín pé ẹ má wọrí a bá yín tọ́jú wọn pọ̀ kò sí yẹn Nàìjíríà o nítorí ìdí èyí àwọn mìta rí lọ hospital pàápàá wọ́n máa ń pa àwọn ọmọ yẹn tó bá ti rí pé àwọn ọmọ yẹn ò ṣe dáadáa ó ní èèyàn kan tó wá sí hospital ó ní ká máa treat ọmọ à ń treat ọmọ wọ́n wá rí pé ó dàbọ̀ ọmọ yìí ò ṣe dáadáa tó a ní kó ṣàyẹ̀wò ọ̀kan wá ní òun fẹ́ lọ ṣe ń tà ó wá lọ síta láti lọ ṣe àyẹ̀wò kò gbọ́mọ padà wọ́n sọ fún wa pé àwọn ò fẹ́ treatment wa mọ́ báwọn ò wá mọ́ ó gbọ́mọ lọ ń bí báyìí ó gbé padà káwa wò kò rí bẹ́ẹ̀ yẹn o lọ gbọ́mọ wá along the line àmọ́ ẹ pé ó wá sọ fún ẹ pé ọmọ yẹn ti kú along the line àmọ́ ẹ pé ó ti bẹ́rí ọmọ yẹn so tí nǹkan bá ń ṣẹlẹ̀ bẹ́ẹ̀ yẹn àwọn èèyàn apá mọ́ra á wá wọ̀rọ̀kọ̀ ṣàdá pé lè ò ní bà mí lórúkọ jẹ́ ó dẹ̀ máa ń fa wàhálà nínú ẹbí ńgbà míì tí nǹkan bẹ́ẹ̀ bá ṣẹlẹ̀ ó lè má jẹ́ ẹ̀bi bàbá àti àbí ẹ̀bi màmá but tí nǹkan bá ṣẹlẹ̀ a máa wúra wa àmọ́ alágbájá kò sírú nǹkan yẹn family wa o family yìí ló máa wà bàbá alágbájá o ṣe àrí gbogbo àwọn ẹ̀gbọ́n mi àtàbúrò mi ìwọ nu wọn ló dà báyìí family yìí ló máa wà á wá dìjà so nítorí ìdí èyí ni a ṣe ní irú àǹfààní yìí láti bára wa sọ̀rọ̀ so that a fẹ́ kó dọjọ́ iwájú because tí kíní yìí bá ń pọ̀ sí ó lè dọjọ́ iwájú ń gbà mí kó jẹ́ pé àwọn olórí wa gan pàápàá wọ́n ṣe máa sọ̀rọ̀ ní now that's a big problem a fẹ́ yẹn so a need láti wá nǹkan ṣe sí i a dẹ̀ need àwọn support tó ń fún wa bí àwọn treasure kids so we need a lot of that àwọn míì nú wọn àwọn míì bí irú àwọn tó bá jẹ́ pé wọ́n ní T21 máa ń pè wọ́n àwọn míì á pè wọ́n ní Down syndrome àwọn míì á pè wọ́n ní Mongol but so that tá bá ń lórúkọ yẹn Down syndrome bẹ́ẹ̀ mi ṣe ń wò ó ní pé à ń stigmatize ọmọ yẹn nìyẹn so mo ń sábà lo Down syndrome or kí n lo Mongol bákan ní T21 so that àwọn tó wà láyìíká wọ́n tẹ̀lé má mọ̀ nǹkan tí mò ń sọ̀rọ̀ nípa because ẹ bá ní Down syndrome everybody ló mọ̀ nǹkan tẹ̀ ń sọ̀rọ̀ nǹkan ní ọmọ woman yẹn Down mà ló mà ní Down ló ní no we don't do it that way àwọn yẹn náà lè máa ṣe dáadáa wàhálà tó wà ń bẹ̀ ni pé àwọn tó wà ń ta wọ́n lè máa take advantage wọn because àwọn Down syndrome lè máa ṣe dáadáa ó dẹ́ pé sexual abuse our common and níkẹ́ bọ̀dá Akeem níkẹ́ wọ́n á tọ́jú ẹ̀ lọ síbì kan wọ́n á bá a ní àjọṣepọ̀ wàhálà tún dé fáwọn òbí ìkan wà àti ìrántán ọmọ tún ti lóyún tá a bá ṣe àkíyèsára kí ní akọ̀ máa lọ bẹ́ẹ̀ yìí cycle wàhálà dẹ̀ ló máa jẹ́ fáwọn òbí so tá a bá rírun nǹkan báyìí kí la lè ṣe ìjọba ń gbìyànjú bọ́n máa tún jẹ́ ká mọ̀ pé àìmọye àwọn doctors wa ló ti kúrò ń lù tó ti jáde lọ nítorí pé bóyá wọn ò fún ọ lówó tó tó nígbà míì àwọn aráàlú gan ò lówó tó tó àdúrà là ń gbà kí n tó máa ṣe ọ̀rọ̀ tí mò ń sọ lọ báwo lára yín o ṣe wà déédéé nítorí Nàìjíríà tá a wà ń sìn yìí táwọn èèyàn bá wá sí hospital ìgbà míì ẹlòmíì ò ní mú kọ́bọ̀ wá sí hospital nínú owó tó ń fún àwọn dókítà yìí náà la fẹ́ pé ó yá ẹgbà ẹ lọ ṣàyẹ̀wò yìí ẹgbà ẹ lọ ṣe tọ̀hún but àwọn èèyàn máa ń rẹ̀ pé àwọn dókítà wọn kó yẹn dání ó pọ̀ lọ́wọ́ gọ́ but èmi ò ní private hospital ẹ mọ̀ ìdí tí mo ṣe ní private hospital mo lè wo patient mo lè ràn lọ́wọ́ kí n má ràn lọ́wọ́ nítorí pé kò lówó láti san tí n bá dẹ̀ ṣe yẹn mo ní lówó lọ́wọ́ máa fowó tọ́jú àwọn èèyàn ni nítorí ẹ̀ mo ṣe lè ṣe kí n wo èèyàn kó kú tí mo lè ràn lọ́wọ́ mo ò tí ì ní ẹ̀mí yẹn láti ṣe irú nǹkan bẹ́ẹ̀ so tá a bá fẹ́ ràn wọ́n lọ́wọ́ àwọn tó wà ní PHC wa primary health care wọ́n lójúṣe tiwọn láti ṣe tó tóbi gan-an because kẹ́ tó dé general hospital ẹ ti dé primary health center láti wò ó ṣé àwọn ọmọ yìí ń gba abẹ́rẹ́ àjẹsára wọn ṣé wọ́n ń gbàtọ́jú tó tó láti ibẹ̀ gan a lè mọrú àìsàn tó ń ṣe wọ́n eléyìí ó ti ní báyìí o then tó bá dé stage gan lọ bá wọn general hospital nílé ìṣẹ̀lẹ̀ o then látọ̀dọ̀ wa ní general hospital pẹ̀lú ìrànlọ́wọ́ àwọn treasure kid àtàwọn ẹlòmíì àwọn kí la lè ṣe sí i but báwo lóyìnbó ṣe máa ń sọ prevention is better than cure, but bí mo ṣe sọ tẹ́lẹ̀ náà àwọn kan kò sí bá a ṣe lè prevent ẹ̀, inú gene ló wà. Àfi táwọn òyìnbó bá dẹ̀ ṣe gene genetic engineering láti help, but kò ní help ọmọ yẹn, maybe the next child ló máa help. So what do we do? So we all need to play our own part and to play our role. Ẹ jẹ́ kí n wò bóyá nǹkan wà tí mo ò tí sọ̀rọ̀ nípa. So àwọn intervention tá a máa ṣe nìyẹn. A nínú àwọn tó ń gbẹ̀bí nínú wa tó jẹ́ àwọn TBA, ó láwọn oògùn kan táwọn màmá yìí gbọ́dọ̀ máa gbà láti dákun àwọn àìsàn báyìí ńgbà míì tá a ní láti mọ̀. Gbogbo ẹ̀ a lè jókòó sí ibà ká máa sọ. Nígbà míì tí èèyàn kan bá bímọ tí ọmọ kìíní bá kú tó bí kejì tí ò ń ṣe dáadáa, ó ṣe pàtàkì fún àwọn tó wà ní obstetrics wa láti wòó pé láti ṣe nǹkan tá a máa ń pè ní screening, genetic screening, pé kí ló ń fà á. So a lè help wa láti tún dákun sọmọ àwọn nǹkan tá à ń sọ̀rọ̀ nípa yìí. Mo ti sọ oríṣiríṣi, màá fẹ́ dúró láti wò bóyá ẹ ní ìbéèrè, ìyẹn tún lè ràn wá lọ́wọ́ láti tún lè sọ sí. Ẹ ṣé púpọ̀. Àwọn ọ̀gá wa ń bíbá wọ́n ní kí n give summary gbogbo nǹkan tí mo ti sọ ní Yorùbá fáwọn tó ò bá gbọ́ Yorùbá dáadáa. So what I've tried to say, I've tried to analyze prevention, early diagnosis, and intervention of congenital malformations. And I said that majority of the disease that we have are actually as a result of two major things: nature and nurture. Some things we are born with, some things we are born with by reason of inheritance. Some things we acquired along the pathway while we are being born. It may be while the baby is in utero, or during the process of birth, or along the process after the child has been born. And I said also that some things we cannot change because they are genetics, but there's some that we can prevent. And a lot also lies with our obstetricians, because if you give me a baby that has severe perinatal asphyxia, I may not be able to do much. The damage has been done. The baby might not die, but the aftermath of the severe perinatal asphyxia is a big issue for the family. So if we are able to do the necessary thing on the side of the obstetrician, on the side of the pediatrician, because sometimes this baby have hypoglycemia, and if it's not detected early, they can also have issue from hypoglycemia. So it is better for our TBAs to know their limits, because if they don't, then we're going to be having issues, and to know when to refer, and refer early and adequately so that there won't be issues. It's someone's life, it's someone's child, and we should take care of that. And by way of intervention, we need to be able to make early diagnosis, because if you don't know a thing, you might not be able to intervene. And a number of times when we have patients that have T21, so some of the tests are quite expensive. You know, doing a karyotype, for instance, is expensive. And doing a genetic screening is also expensive. But those are the things we need to do so that we can prevent it. And even when we now discover that, okay, this is unpreventable, like the lady was saying, we now have to, because for us, when you talk about prevention, we're looking at 5 levels. We talk about the general protection, the specific protection, we talk about early diagnosis and treatment. And we also talk about reduction of impairment. If we know that a child is likely to have CP, then we start doing something about physiotherapy and so many other things so that it does not become bedridden or having to sit on a wheelchair for a lifetime. And we have to consider rehabilitation. What can we do to make this child live a fairly normal life as much as possible so that this child does not depend on the parents? So we start looking at what can he do? Which kind of occupation can he be engaged in? And that will ease out the burden on the parents. So I've said these things because, just briefly, because I know we know a lot of these things. So I'm going to leave time for us to ask questions so that will help us. And it will also help me. You know, àwọn Yorùbá máa sọ pé àǹgbà téèyàn kì í ṣe rédíò àsọ̀rọ̀ máa gbèsì. Mo gbọ́dọ̀ sọ̀rọ̀ kí n dẹ̀ gbèsì now. You know, so I will leave room for few questions. Thank you so much.
Please a round of applause for Dr. Adegboyega, the pediatrician for Alimosho General Hospital. Now it is time for our questions section. Taba ní ẹnikẹ́ni tó fẹ́ béèrè ìbéèrè lórí àwọn ohun tí wọ́n ti bá wa sọ yẹn. Ẹ jẹ́ àmọ̀yé àwa tá a fẹ́ béèrè ìbéèrè so that a lè gba iye wa a dẹ̀ ní fẹ́ kí máa wáyé nínú ìbéèrè. Please, if you want to ask any question, please raise up your hand so that you can note the number of people that will be asking questions. Thank you. Ṣálẹ̀ tó tún fẹ́ béèrè ìbéèrè èèyàn méjì péré ló nawọ́ sókè o mẹ́ta ṣé kò sí mọ́ ẹ ṣeun lọ́pọ̀lọpọ̀. Thank you very much.
Yeah, thank you. The first question ni Omalosoro doctor. Problem ta ní Nàìjíríà ni pé àkìrànra wa lọ́wọ́. Gbogbo òyìnbó tẹ́ sọ lẹ́ǹsì ó dáa. Bàbá kúrò ń bí gbogbo àwọn obìnrin tẹ́ wo ìtọ́jú ìkíní. Ǹjẹ́ ìrànlọ́wọ́ wo lẹ fẹ́ ṣe tó bá gbé wọn wá sí General Hospital yẹn? Lọ́dọ̀ tí yín ẹ̀yin la rí ń sìn àrí ìjọba o. Ó ti sọ fún yín lẹ́ẹ̀kan pé òun tó fi owó tòun ṣe ìjọba ni. Ẹ máa jẹ́ ká máa gbọ́rọ̀. Ṣé most of the problems ta ní nílùú yìí a kì í help ara wa. Ẹlòmíì nú àwọn obìnrin tó wá sí ibùdó ìlú kò sí tẹ́ńkọ̀bọ̀ lọ́wọ́ ẹ̀kọ́ tó débi o. Sọ̀rọ̀ mi yẹ yín sà. Tó bá wá sí General Hospital problem tó ń face ó lágbára jù ló ń jẹ́ ká everybody sit back wọ́n fi jáde wá kí ilẹ̀ lè ṣe léni ṣé ká gba nọ́mbà yín wọn ká fún yín àbẹ́ máa fún wa ní káàdì tó mo fẹ́ kẹ́ commit ara yín gbogbo àwọn tó wà níbílẹ̀ ni wọ́n máa jàǹfààní yín o. ok mi ní sùúrù kì í ṣe pé òkè ó máa ṣe é ṣe ni.
Ẹ máa ṣe ẹ máa wọ
ìyẹn ẹ jọ̀ọ́ mo fẹ́ bẹ̀ àwọn èèyàn that's the second one nígbà tó ní kí wọ́n ṣe screening fún àwọn ọmọ yìí ní last week àwọn èèyàn ò jáde ìdí tó wọ́n fi jáde ni pé ìjọba ò kí ràn yàn lọ àwọn NGO oríṣiríṣi ló ti jáde síta wọ́n kàn ń dààmú àwọn èèyàn ni wọ́n á jẹ́ kọ́pọ̀lọpọ̀ sá sẹ́yìn wọ́n tún fẹ́ lọ fi wọ́n gba owó doctor sir. A mọ̀ pé ẹ fẹ́ ràn wá lọ́wọ́ ni. Èyí tẹ́ ẹ ṣe tẹ́ máa ṣe lẹ́nu yìí wọ́n á padà lọlé lọ ròyìn. Ṣé àmọ̀ pé mélòó la fẹ́ mú ní local government tẹ́lẹ̀? Tó bá jẹ́ 9 lẹ́mú lẹ́nu tó bá jẹ́ 12 afẹ́kẹ́tù ṣe sí. Èrò pọ̀ o. Number 3 mo sọ the other time. Ẹ jọ̀ọ́ we have people that is above 12. Bó bá jẹ́ pé ẹ fẹ́ ká lọ bẹ̀ ká lọ kọ lẹ́tà sí wọn kọ́ ràn wá ẹ fún wa ní link yẹn. Àwọn ọmọ kan míì ti dàgbà tó kọjá 12 years. Ọmọ míì 21 years. How do we help them? Ìjọba máa ràn wọ́n lọ́wọ́. They are just lying down there. Please, we need your help. We need it. We will support you. We are ambassador. Support you. Please get us the doctor. Jẹ́ ká lọ máa kọ nọ́mbà wọn ká máa kọ́ ọ̀kọ́ wọn.
Ẹni sùúrù kò máa kúkú lè tó bẹ ṣe ń ròyìn ẹ̀. Nǹkan tó wà ń bẹ̀ ni pé actually ní gbogbo ibi tí n bá ń lọ mo máa ń fún ọ ní nọ́mbà mi. Tí n bá dẹ̀ fún ọ ní nọ́mbà mi, tẹ́ ẹ bá dé Àlímọ̀ṣọ́ General Hospital kẹ́ bèrè Dr. Adégbóyèga àbí HOD. Because nígbà míì mo ti fáwọn kan nọ́mbà mi torí pé ọmọ ẹ need assistant. Tó bá ní wàhálà ò pè mí màá dẹ́ lóhùn. But àwọn tó ń pè mí wọ́n pọ̀. Kí ló dé níbo ló ti nọ́mbà ẹni dágbájá ló fún mi nọ́mbà yín pé mo lè. Kò rí bẹ́ẹ̀ yẹn èmi náà ní ayé láti gbé. I have my life to live. Mo ò kàn lè máa ṣe gbogbo yẹn. So but ẹ bá débẹ̀ èèyàn sọ fún ẹ pé Dr. Adégbèga ló ní kẹ́ ẹ wá. Okay, ẹ má worry tó bá jẹ́ pé yìí ni a few people can have my number because you may actually need my assistance, you know, and I should be able to offer that assistance. Tí n bá dẹ̀ lè ṣe mo ò lè parọ́ fún yín pé màá ṣe nǹkan tí mo ò lè ṣe. Màá jẹ́ kẹ́ ẹ mọ̀ bó ṣe ń lọ. Yes, so nǹkan tá a máa ṣe ń pa yẹn nìyẹn. Ẹ má worry. Nàìjíríà ń gbogbo wa. Ó kàn rí báyìí náà nígbà táwa ń dàgbà kò rí báyìí. Ọ̀dọ̀ ẹlòmíì lọ máa ń gbé wa sí nígbà táwa bá ti lọ school táwọn parents wa bá ti lọ síbi iṣẹ́. Àwọn ló máa ń tọ́jú wa, àwọn ló máa ń wẹ̀ fún wa. Nàìjíríà tẹ́ mi gbé nígbà tí mo wà kékeré nìyẹn. So eléyìí tó wà sí yìí kò yé mi. Ọlọ́run á jẹ́ kó lọ. Ẹlòmíì béèrè ìbéèrè kan lórí pépà. Wọ́n ní tubular myopathy. Please, reason why only or commonly occurring in male child. Now, if you listen, or maybe you are not there when she was saying it, it's an S-linked disease. When you say something is S-linked, it means it occurs more in males. Maybe an S-linked dominant, which means everywhere that there's an S gene, that person will have the disease. So female and male will both have the disease. Now, if you're not saying S-linked recessive is on S chromosomes. Now, if a male has, you know, the male will have SY. The only S that is having has the disease, so it will manifest with the disease. But for the female, she still have another S that is not affected. So she may not manifest that disease. She will just be like a carrier. That is why we call it S-linked disease. So I think we should take other questions.
Before we take the question, I want to respond to Baba, and I want to say it in honor of this doctor. He's collaborating with TKF, and he has been with us since the journey began. And immediately we are through, the first level of our support is to bring all the cases for consultation to him. And he has agreed to meet with them. Within his time, he has agreed to meet with everyone we have here. He's going to meet with them on consultation. So I want us to please clap for him already, and also clap for the government already for that. Thank you very much, sir.
Yeah, thank you very much, Doctor. We quite appreciate your effort in educating us on this topic. Now, during the course of your lecture, you said you refuse to call these children Mongol or call them T21. We'd like to know what this T21 stands for. You equally mentioned TBA, the full meaning of TBA. The last but not least is what Baba has mentioned. You see, when you visit the hospital, what you face there is highly discouraging. The way some doctors, even the nurses and the attendants, the way they attend to you will make you not to have interest in going there again. Is it? If government can do concern, happy. Thank you very much.
Thank you, sir. I will start from the last one. I think the doctors sometimes are disenfranchised. After reading for such a long time and they're not able to get what they want, sometimes it takes older doctors like ourselves to do certain things. I understand what you are saying because sometimes I walk around Alimoshe General Hospital, even in pediatric department where I work. I mean, if you have ever been there as a mother, you will know me. Because I get to the hospital around 7:38. And I look at what is happening. And I go to the emergency. If there is problem, I try to sort that out. That's the way I work. And if you have issues and you call on me, I will not turn my back on you. So the only reason why I would turn, like some people are calling me while I was coming here, I said, if I start answering you, I will not get here for the time I'm supposed to answer. Madam, I'm going somewhere, I'm coming back. Because there's some in the neonatal ward that want to see me, and I have to tell them, sorry, I'm going for a meeting. So if you don't take that excuse, you may not be here. So I understand the plight that even for you to even pay the money, the process you have to go through is enormous. I've thought about even for our own pediatric section, mothers have to sit when their babies are there till daybreak. And the nurses said, when they want to sleep on the floor, Emma, now, the thing is, you are saying they should not sleep on the floor. Have we created a place where they should sleep, where they can sleep? Now, even sitting on the chair is not comfortable for anybody. So I'm thinking, if I have money, I've told Treasure Kid also, I've said this over and over again to Treasure Kid, that I would like to get a reclinable chair in our emergency so that when they sit and it's night, they can straighten and sleep. They are not animals. Don't treat human beings like animals. So that is my own belief. Others may not believe in the same thing with me. I have a conscience that pricks me. And I know everything will not end there. I'll have to stand before my Creator one day and give accounts. That's what pushed me to do what I do. So the second question is, what is TBA? TBA is traditional birth attendants. We know them. T21. Why do we call it T21? I will take you back to school a little. We have 22 autosomes. So what we call cell chromosomes. And we have one pair of sex chromosomes. One pair making two. Maybe SS, maybe SY. The autosomes are 22 pairs. So if you add the two together, they form 23 pairs, which is 46 chromosomes at the end of the day. Now, of the chromosomes that we're talking about, the autosomes, for any child to have T21, it lies on the site, on the 21st chromosome. So if you count, 1, 2, 3, 4, 5, 6, on the 21st chromosomes, instead of having 2, they have 3. That's why we call it trisomy 21. On that chromosome 21, you have 3 chromosomes instead of 2. Sometimes it may just be 1. Then we will call it monosome, like we do have in some other disease conditions. Don't let me take you too much into medicine. But because you asked the question, why T21? I prefer it that way because that's what happens in Down syndrome. Do you understand now? Thank you. The other person?
Good afternoon. I would like to know more about the cause of spina bifida hydrocephalus. And please, we would like you to help us talk to the government. The drugs of our children are very expensive. The drug is too expensive. We can't afford it. We mothers, we are trying. Their food is there. Their diapers is there. So the The government should work towards it, please. Their drugs is getting expensive every day by day. For us to afford it is not easy. We want them to work towards it. Their therapy money too is expensive every day. We are not paying this money before, but it's getting much every day by day. We pay for speech therapy before we can pay for occupational therapy. What about the physio? For us to get their chair, their standing frame, some materials for them, we can't afford it. Like me, I'm one of them. I've stopped so many of the things I'm doing because for me to afford the money is not easy. The food others are eating, most children don't eat normal food. We have to blend. And no lights for us to blend. For us to buy cereals, we can't afford it. So why is their drug expensive again? A child monthly for us to buy drugs of 50-something thousand. How can they achieve milestone? They won't. So most of us, we are relenting. We want them to work towards it. Even if we see helpers too will get tired one day. There are so many children indoor that they are locking inside. Truly, government are not helping us, we mothers. We are not happy about the way they are treating we mothers of special need. We are not happy. We see the way they are doing others in outside countries. They care much for them. Yeah, they don't care about us. They are still hurting our feelings. We mothers, we are depressed. They don't care about our emotion now. Please, we want the government to work towards it. The expensive is too much.
Thank you for the question. I'm not government, and I'm not standing here as government. I have my own issue too that I wish government can help me with. So we all have our issue. But maybe Treasure Kids and some other powerful people seated here can help us. You know, what I would tell you is do as much as you can, and seek for help. I will tell you, you can't do more than you can. I do understand that. And seek for help. If you see me or you see Treasure Kid, let's look if there's another way we can go around it. Sometimes things are not provided, even at our own end. But I have to find a way to provide those things. So I understand your plight. While I was in Lasuth, I will give you a scenario. There's this lady, her first child has severe perinatal asphyxia and was not able to attain developmental milestone and was brought to the hospital. Her second child had hydrocephalus. This used to be a very jovial, friendly lady, but after the second one, she lost a lot of weight. So when you are saying some of these things, I've seen raw some of the things you are talking about. And I wish I'm also an NGO. Your Bible will say, I am not in that position to have money and not be able to help people. Because my peace lies in your own peace. And that is the way they see it outside this country. So, if I'm able to, I will do as much as I can. But don't worry. When you come see Treasure Kid, we'll find a way around as much as we can also. But that lady, at the end of the day, she was worn out. I'm not too sure. The husband was not even coming along with her anymore. And she will carry the one with big head on this hand, weighing her down. And the one that cannot control the neck. So some of these kids need to be in institution. But we don't have such facilities really. Modupe Coal is filled up. The one the government built, I think, on Lekki is filled up. And by the day, people are abandoning babies. We have one in our pediatrics ward, just abandoned. And I'm thinking, not because I don't have faith, that it might just be the beginning. We had one that stayed with us for over 1 year. Another one too is on admission now. And as many babies that are having CP, people tend to abandon them if the parents don't have enough strength to kill them. Like the other one I told you about. Now, going to your main question, which is hydrocephalus and spina bifida. Please sit down. Except your baby is making you okay. Good. Okay, no problem. Spina bifida and hydrocephalus, they have a lot of things in common. Now, spina bifida means that the spinal cord might be bulging to the spine. It may be the lumbar or the thoracic vertebrae. It's not just spina bifida. It may be another type, or there are two different types. You have what we call meningocele, in which only the meninges covering the brain or the spinal cord is coming out. And we have another one we call meningomyelocele or myelomeningocele, in which the brain substance is also coming out through the same orifice. Now, in the past, Loba, who is a neurosurgeon in the US, created a criteria and said that if they have these things, we should not repair it. But these days, with the advent of medicine, people believe that all spina bifida should be repaired. And sometimes when you repair that, the spine is leaving a space for bulging. But when you close it, everything moves to the brain, then hydrocephalus can develop. Sometimes you may have hydrocephalus without a spina bifida. And what is responsible? People have advocated and research have shown that deficiency in folic acid is a predisposing factor. And if a mother has a child with hydrocephalus, chances of having it the second time is like ×2. Now, some other people feel that if you are also on antiepileptic drug like phenytoin, that could also reduce the amount of folic acid, and that could also result in mothers having having hydrocephalus or even spina bifida. So it is important for mothers to actually attend antenatal, proper antenatal, to reduce the incidence. And when patient comes down with spina bifida, especially in children, something has to be done about it. Sometimes you get arrested. It's not only when they are born that they can have spina bifida. Don't let me give you a long lecture, because I can say a lot on hydrocephalus, and I can say a lot on spina bifida, but it has to do with the brain, and we have to reduce that is the one I call Mualadori in usage when they have hydrocephalus. So we do a shunt that reduce the amount, and along the line they may also have infection and so many other things. So there are complications, or even the management and even the hydrocephalus on its own. Spina bifida, the same. They may not even have spina bifida alone. They may come with cleft palates, and so many other things. So the other things I would like to tell you, they are academic things, and I don't think I should bore you with that. Do you understand? Thank you. I'm done. Oh, thank you so much. It's a pleasure being here. I wish you well even as you go home. And I pray that God will keep us. Thank you so much.
Please let's appreciate our doctor for that wonderful section given to us. And I believe we are all satisfied now with the responses. Thank you very much. Now moving forward, during the section, we have the arrival of our permanent secretary in our midst. Please permit me to introduce her to us. We have the presence of our dear permanent secretary, Lagos State 8th District 1 in our midst. I humbly mention her name in person of our mother, Dr. Olufunmilayo Bankole. You are highly welcome, ma'am. You are highly welcome, ma'am. Now we are now in item number 10. That is a testimonial from one of the beneficiaries of Treasure Keys Foundation, and the person coming forward to give this testimonial is no any other person than Mrs. Taufikat Alao, Mommy Jamal. Please come forward for your testimony. That is one of our champions in Treasure Keys Foundation. You are highly welcome, and please let's appreciate her as she comes forward.
Good afternoon, everyone. My name is Taufikat Alao. My name is Mrs. Taufikat Alao, and I'm here to talk about what I've benefit from TKF Foundation. I'm so grateful. When I met them, they did a lot of surprises for me. Seriously, it was amazing. I'm really benefiting a lot from TKF, and thank you so much. I really appreciate for empowering me and my child as well, for helping my child in so many ways. I really, really appreciate, because I message a lot of foundation, no response. But TKF reached out to me and helped me financially with my child and everything I need. They support me in everything I need. Thank you so much. God bless you.
Please let's appreciate her for that wonderful testimony. I believe we can hear her very well, Abi. So those are part of the beneficiaries and those who have benefited from Treasure Keys Foundation. Now moving forward, it is now time to listen to another time of, dialogue section. I won't call this a lecture. It will be more of a dialogue, because we want to talk to ourselves. We want to converse on what we can contribute as well. And that will take us to raising a community of change with one. And this will be taken by no any other person than our permanent secretary, Lagos State 8th District 1, in person of Dr. Olufunmilayo Bankole. Please, with a resounding clap, let's welcome her to the podium. You are highly welcome, ma'am.
Thank you very much. Good afternoon, ladies and gentlemen, our daddies and mommies in the house. I want to appreciate the organizers of this conference for inviting me to be here today as the keynote speaker. And in giving this keynote address, I want each and every one of us to look inwards. That is, what can I offer? What can I bring to the table? I was sitting down there when one of the mothers was speaking. She was so passionate about the price of the medications. This is something that is, common nowadays, because of the economic situation in the country. But I want to encourage each and every one of us, like our lecturer mentioned, let us seek help. We can only do the bit that we have the power to do or we are empowered to do. But when it goes beyond what we can do, let us look for help. But in looking for help, I want to encourage that we do it in the right quarters, in the right direction. As a foundation, I believe that the organizers of this conference can put together a communique after this conference and forward it to the agency in Lagos State that takes care of people living with disability. When we want to approach government agencies or government in quote, because we all are government. How many people agree with me about that? Yes, all of us here, we make up that government. So we need to know how to channel our requests in a way that it will be heard. And when we channel that request, we should also make sure that we follow it up. Because sometimes when we make requests and we don't follow it up, it will just be somewhere hanging. It is not that government does not want to help us, but we need to follow things up to a logical conclusion. I hope that has helped a little bit. The lady that was asking the question, and also to our foundation. So I will go ahead and give my keynote address at this time. Ladies and gentlemen, esteemed guests, parents, caregivers, and advocates, it is truly an honor to be here today, surrounded by such passionate individuals dedicated to making a difference in the lives of our treasured kids with special needs. Today, I want to talk about how each one of us together can build a community of change, one step at a time. And I want to emphasize that it has to be one step at a time. Like we were saying, when we want to ask for things from government, don't let us put 10 requests together in one letter. Make it one, maximum 2 or 3, so that there's a focus in channeling our requests towards creating a more inclusive world for children with congenital and genetic disorders. First, I want us to envision. When I say envision, it's just like an architect. When an architect is trying to design a building, you don't see the building physically first, but it is in their mind, isn't it? They create in their mind, they see it in their mind, then they put paper and pencil together, begin to draw, because that thing they're going to create is already a reality in their mind. Thank you very much. Somebody said that. It's already a reality in their mind. So I want us to begin to envision. Let us create that world for these children. First, in our mind. Make it a purpose and a passion that we fight for. When we do that, we are driven by passion, we are driven by purpose, and there is no limit to what we can achieve when we have that as a foundation for which we build on. And we see beyond disabilities. We begin to recognize the unique abilities and potential within each child. So each and every one of these children, there's something that they can do. If we are able to discover their potential, and help them to channel that potential in the right direction. As a physician, I've had to treat some of these children who have visual problems. And sometimes, because they cannot see well, parents tend to think that there isn't much they can do. But I had this one patient, she's an albino. We all call her Oyibo. This girl, she was not very cerebral to finish going to the university, but she was able to have secondary education despite the visual challenge. And to everybody's surprise, there was one time I was seeing her and I was asking her, but what do you want to do? She said she can act very well, like acting drama. I said, okay, if that is what you can do, why don't you put your effort into doing that? And she started gradually. She joined, even though she could not go to the university to study theater arts, but there are some of these NGOs and some outfits who train people locally to be able to act. She joined them, and today she's doing very well. She's happy in what she's doing. So let us look for such situations where we can encourage these children. I believe each and every one of us can do something about this. If we have a child that is, coping with one disability or the other, and they can still learn, encourage them. And you'll be surprised how much and how far they can go. So as we embark on this journey together, let's remember that change starts with us. I want you to tell your neighbor, that change starts with you. And tell yourself, that change starts with me. It is in the everyday moment of kindness, showing understanding, advocating for these children, that we pave the way for a brighter future for these individuals. Let's amplify their voices. Children don't have a voice, so to say, but we can be their voice. So any opportunity that we all have, let us be that voice and speak up for them. Let us break down the barriers and champion policies that will ensure that they have equal access to opportunities and resources like their other counterparts do. How many educationists are here? Do we have people here from the education sector? Thank you very much. Now, in other climes, we're talking of inclusive education, isn't it? Yes. If they're in your school, please don't tell the parents to take them away because they're slow in learning. And we want you also to go out there and be an advocate to other school owners. These children can be encouraged when we allow them to mingle with other children and pick up some skills that they can live by. We want to talk about the power of collaboration. Do we have some NGOs here also? Any NGO here who deal with disability? None. Okay, but I believe that the people that have invited us here today, Treasured Kids Foundation, is an NGO. Yes, working and helping us. Let's give them a round of applause. This is great work that they're doing. But beyond just one foundation, you as a foundation can champion the cause of inviting other foundations to work along with you to help these children. I'm not sure if we have Lashma agency invited to this conference. Do we know about Lashma? Ilera Eko. Yes, the social health insurance program of Lagos State. There's a unit, there's an arm of LASHMA that helps people with disability. We also have from Lagos State government, LASODA. That is also an agency that helps people with disability. So let us invite all these people to this kind of conference. Let us engage them beyond the conference. Let us get to their offices and talk to them. There's a way, when there's a will, the people say there is a way. When there's a will to champion the cause that we believe in, there will be a way. So we need to break down the silos, build bridges between healthcare professionals, education institutes, and social services. We need to get to the Ministry of Youth, Sports, and Social Services and ask for the help that we need. We need to develop inclusive policies and programs that address the unique needs of children with congenital and genetic disorders. Let us provide training and resources for caregivers. Somebody just gave a testimony this afternoon how Treasured Kid Foundation have empowered a mother to be able to care for these children. So let us, as individuals, some of us may be able to fund some of these training programs. How many people can do that? We can support Treasured Kid Foundation, donate to them. Thank you, sir. To help them organize trainings for mothers and caregivers. So, all these are the things that we can do. And finally, I want to talk about creating a more inclusive world, making accessible healthcare services that cater to the unique needs of children with special needs. Inclusive education, we mentioned that values diversity and promotes social interaction. We need to create supportive communities that provide emotional and practical support to families. If you listen to the voice of some of the mothers that have spoken today, they are very passionate, they are very emotional. These issues can actually bring up a lot of emotional needs in the family. And there are people who specialize in giving therapy for emotional distress. We can include them in our planning and get them to team together with the foundations to empower caregivers who are equipped with the knowledge and resources to advocate for their children. In conclusion, I want to urge each of us to be the catalyst for change, the beacon of hope, and the champions of inclusivity. Together, we have the power to shape a world where every child, regardless of their challenges, is embraced, empowered, and valued, and shown love like other children. Thank you very much for your dedication, everyone that is here today, for your passion, for your commitment to building a more inclusive world for our treasured kids. Thank you very much for your attention.
Please, let's appreciate the Permanent Secretary, Lagos State Health District 1, for that brilliant keynote address. As we have heard, we are all that agents of change, and we want to know this, that this change begins with you. Say to yourself that this change begins with me. Raising a community of change with one. not sleeping. Raising a community of change with one. Thank you very much. Please, let's appreciate ourselves. Once again, we appreciate our permanent secretary for that wonderful keynote address. And now we are moving forward. It is now we want to hear from you as stakeholders. We have our traditional leaders here. We have our community key stakeholders here. We have our CDC, CDAs. We have community health practitioners here. We have our nurses here. We have a lot of people here that we cannot start mentioning one after the other. Now we want to hear from you. What is your contribution? What is your commitment in order to help this foundation to reduce the issue of stigmatization in our various communities? Most of these children we are talking about, many people have turned them to errand boys and errand girls, whereby they send them errand here and there when their parents are not at home. Sometimes most people even molest them because they are vulnerables. Now we want to hear from you. Moving down to the panel section now, we want to hear from you. How can you be that agent of change we are talking about here? So please, we just need a representative from each categories. We have the youth here. Build the youth. Thank you very much. We one, yes. And also we have our traditional leaders here. Community health is our concern. Thank you very much. And also we have our women leaders here. World Health Committee. Earth is Wealth. Earth is Wealth. So we want to hear from these various stakeholders that are here. This is the panel section now. We want to hear from you. How can you contribute? How can you be that agent of change in your various community? What is your contribution to this foundation? Unlike our peers before, she asks that who are those that can donate, that can give, that can support? Everything is not financial support. We have other support like moral and the rest that we can use in raising help for those that are in need, in raising help for these children that are vulnerable. So please, we need representatives from these various stakeholders who can, showcase or speak on behalf of these people that are less privileged, on behalf of our children, on behalf of our children that we look as the vulnerable in our various communities. So please, we need representatives, we need volunteers from each stakeholders that are here represented, starting from our traditional leaders to our Community Development Committee and Community Development Association that are here, to our World Health Committee, to our women leader, to the youth, to our community health practitioners, and nurses, and the like. So please, I just need one representative each. And also our government, the representative of our chairman, we have the representative of our executive chairman here in our presence also, in person of Honorable Olawale Azan. Please appreciate him, please. Appreciate him. He will also have something to contribute. So let me start from our traditional leaders now in order to save our time. Thank you very much.
Good afternoon, ladies and gentlemen. My name is I Chief Lukman Saka, Bale Modo from Akeson. I just want to show appreciation because with the Treasure Kids Foundation, for me, I'm so happy. Because most of we Nigerians, we are ignorant. Aláìmọ̀ kan ló pọ̀ nù wá. Gẹ́gẹ́ bí wọ́n ṣe sọ, sorry, I need to mix up. Gẹ́gẹ́ bí wọ́n ṣe sọ, èmi gan ní àbúrò tó ní wàhùn báyìí, ó dé mọ́lé ni. tí ò dẹ̀ mọ ibi tó yẹ kó gbà. But for me coming here today with the Treasure Kids Foundation, I'm so happy. And as a community leader, I need to pass this message round. Kán ba lè mọ̀ pé kò ṣe pé kán dé ọmọ yìí sílé kán má mójútó wọn. Ọmọ náà lè di nǹkan lọ́la. Ẹ wo irú testimony tí ẹni tó head Treasure Kids tó sọ fún wa. Encouragement ni ẹ̀wọ̀n tó tún wá give testimony lórí ọ̀rọ̀ Treasure Kids. So ní akọ̀rọ̀ gbogbo wa mẹ́sẹ̀gì ọ̀rọ̀ gbogbo wa ló wà tí a bá délé ká pass around. Ẹ má jẹ́ kí a neglect ọ̀rọ̀ náà. Ẹ rí pé ọ̀pọ̀lọpọ̀ ti sọ̀rọ̀ wọ́n dẹ̀ fún wa ní ọ̀rọ̀ èsì tí ó dáa. So tí èmi bá délé ní community mi ní Àkẹsàn as a whole, I'll pass the message round. Thank you very much.
Raising a community of change with one. Kára ó lè sá. Akẹ́yìn bàbá wa ọkọ ìlú olórí ìlú fún ìmọ̀ràn pàtàkì tí ẹ gbà wá yẹn àti fún ìfọwọ́sowọ́pọ̀ tí ẹ ní láti lè wá. In fact, oore ọ̀fẹ́ gan la rí gbà lọ́dọ̀ yín, kára ó lè sá. So àwọn ohun tí ẹ ti sọ yẹn lágbára Ọlọ́run a máa mú lò. Inú mi bẹ̀ tún sì dùn lọ́pọ̀lọpọ̀ wípé ẹ sọ wípé tẹ bá dé inú ìlú ẹ bá wa filọ̀ fáwọn tó wà ń lùlù. Ohun tí mo kàn ní láti fi kún ni wípé tí a bá rí oore ọ̀fẹ́ gbà lọ́dọ̀ yín sà, tí alágogo wa amọ̀pá aláwọn alágogo onílù tó máa ń bá wa lago kiri tó bá lè bá wa fi eléyìí náà sínú àwọn ohun tí wọ́n lè bá aráàlú sọ, so that gbogbo àwọn tó nílò ọmọ bẹ́ẹ̀ yẹn wọn ò ní máa bá wa sé wọn mọ́lé. Kò ní ṣe ọmọ tá à ń gbé sínú ilé nítorí àti rọ́pọ̀lọpọ̀ òbí tó jẹ́ wípé irú àwọn ọmọ wọ̀nyí wọ́n á tilẹ̀kùn mọ́ wọn nínú ilé, wọ́n á fi wọ́n lẹ̀ ọjọ́ méjì ọjọ́ mẹ́ta. Irú ọmọ bẹ́ẹ̀ á wà lójú kan, á yàgbẹ́ síbẹ̀, á tọ̀ síbẹ̀, á tún sùn síbẹ̀. Kò dẹ̀ da fún ìlera ara àwọn ọmọ wọ̀nyí. So a fẹ́ kí òbí kankan tún máa gbé àwọn ọmọ wọ̀nyí pamọ́ mọ́. Ìdí tí irú ètò yìí fi wáyé nìyẹn, láti là wá lóye, láti fi ọgbọ́n kún ọgbọ́n wa kí àwa náà pẹ̀lú kí a tún lè sọ sí bí Treasure Kids ṣe lè tẹ̀síwájú. Ẹ ṣeun lọ́pọ̀lọpọ̀ sà fún contribution yín. Adẹ̀gbàdúrà pé lágbára Ọlọ́run ìlú á máa tẹ̀síwájú o. Lásìkò tí eku á máa ké bí eku sà, ẹyẹ á máa ké bí ẹyẹ, ọmọ ènìyàn á sì máa fọhùn bí èèyàn. Ẹ ṣeun lọ́pọ̀lọpọ̀ sà, àdúpẹ́ lọ́wọ́ yín, kára ó lè kábíyèsí. Ẹ bá wa ṣàwọn látẹ̀wọ́ tó rinlẹ̀. Ní báyìí, we are moving forward, representative from the CDC-CDA. CDC-CDA. Okay, please, let's appreciate him as he come forward. Your contribution.
Thank you, sir. Good afternoon, everyone. My name is Adetunji Adeleye from Egon Joint CDA. In fact, I'm happy to be here this afternoon, and the information that we had here is an information that we have to pass across to all the CDAs in Egon. And this we are going to do at our next joint CDA meeting without any delay. In fact, if possible, we pass information to the health educator so that he can also be with us at the meeting, so that at least we can give it a better advocacy that something like this is going on, and that all hands should be on deck to support Treasure Kids Foundation. Thank you very much.
Thank you very much, sir. Let's appreciate him. Let's appreciate him. Thank you very much, sir. Also, permit me to call forward, we have in our presence the CDC-CDA representative. Our father has spoken well. He will do that assignment when he gets home. He is a representative of a particular CDA. And in Igodo Ikotun alone, we have close to almost 200 and something CDAs. But here presently, we have representative of the CDC, CDA, and the General Secretary for that matter. So we want to hear from the horse's mouth also. Thank you very much, sir.
We. Thank you very much. It's a laudable program. Everybody knows why we are here. And I believe tomorrow is our general meeting. It will be part of our agenda. And when I get back home, I will inform the citizens chairman of what happened, which he knew. But the most important thing for all of us is to know this program is for all of us because we know ourselves as neighbor. You know your neighbor. You know these things are affecting most, like myself. I have my the person that senior my wife. He has a 23-year-old child. He will always lock him indoor. That boy is useless. He cannot do anything. It's at Tabaronje here. I think there should be a law. There should be a law that we Yorùbá ní tá bá dẹ́rù bà ọmọ ìyá ẹni òdìrí ní kásá o tí ìjọba bá lè bá wa ṣòfin pẹ́ni tó bá nírú ọmọ báyìí tó tì mọ́lé òfin báyìí ká wá rìpọ́tì ẹ rí pé àwọn èèyàn á ti àwọn ọmọ yìí wọ́n á tì wọ́n jáde torí ẹni kọ́ torí ọ̀la ọmọ tó ti pé 26 years ó ga tó mi báyìí wọ́n lè tì mọ́lé for 4 days 5 days ṣé mo pé wọ́n ti bá yé ọmọ yẹn jẹ́ so mo bẹ̀ wá ní àdúgbò kọ̀ọ̀kan gẹ́gẹ́ bí kábíyèsí ṣe sọ bálẹ̀ a máa ṣètò a máa ṣèpàdé a wá sí mítìn lọ́balọ́ba a lọ sọ́dọ̀ àwọn ìjòyè a sensitize àwọn èèyàn wa kò tẹ̀ wá ní jẹ́ Ìgàndò Ìkọ̀tún nìkan Àlímọ̀ṣọ́ as a whole. And I promise you by God's grace, this thing will be eradicated, if not finally, because gbogbo nǹkan tó ti ṣe tí àwọn treasure kìsì ní àwọn fẹ́ ṣe yìí mọ̀ pé amúkíní ìkúrò díẹ̀ ní ara àwọn òbí tó bá ti ń gbé bùkátà 300,000-400,000 lóṣù gẹ́gẹ́ bí ìyá yẹn ṣe sọ àárẹ̀ o àwọn ọkùnrin tó dẹ̀ jókòó bí wọ́n ń bá ládánwò ṣe wọ́n máa ya dànù ní tíṣòro bá dé so ẹ jọ̀ọ́ ẹ̀yin bàbá ẹ jẹ́ ká dúró ti àwọn obìnrin yìí ká fọwọ́sowọ́pọ̀ ká lè tọ́jú wọn Ọlọ́run á ràn wá lọ́wọ́. God bless.
Thank you very much, sir. Please, let's appreciate him. Let's appreciate him. Thank you very much, sir, for your contribution. And also, we've taken note. I believe the note taker for Treasure Kids Foundation is taking note of all these salient points that they are dishing out for us. It is very, very important, and we promise you we will work on it. Now, moving forward, we want to hear from the representative of the executive chairman also. Contribution and way forward. Thank you very much, sir.
Good afternoon, ladies and gentlemen. Akiwa aku ìjókòó látàárọ̀. Gbogbo ẹ̀yin abiyamọ tí ẹ wà lẹ́yìn yẹ alága wa ní ká kí ẹ kú ọ̀rọ̀ ọmọ o. Ẹ jèrè àwọn ọmọ náà o. Gbogbo wàhálà yìí kò ní já sásán lórí wọn. Ẹ yẹ kí n fele yìí kún. Ọ́fíìsì alága wa ṣí sílẹ̀ fún yín ní Ìgàndò Ìkọ̀tún secretariat. Individually ẹ lè lọ síbẹ̀ fún ìrànlọ́wọ́. Ìjẹ́ ń gbọ́ mi yé àǹfààní àkọ́kọ́ tẹ́ jẹ́ ní ibíbà ilé nínú yẹ o láti Ìgàndò Ìkọ̀tún local government ọ́fíìsì alága ṣí sílẹ̀ fún individually láti yọjú sí wọn fún ìrànlọ́wọ́ àtẹ̀tí gbọ́ yìí. Bẹ́ẹ̀ni ẹ béèrè office of the supervisor for health office of the supervisor for health a make sure pé a tì í lẹ́yìn lọ́dọ̀ alága 08028 28 34 29 20 àárọ̀ ìlọ́wọ́dọ́dọ̀ alága olójú àánú ni alága wa 080 28 34 29 20 akí yorùbá lẹ̀ akí gbogbo ẹ̀yin bàbá tẹwà níjòkó látàárọ̀ ẹ rí i pé iṣẹ́ tí ọmọ aláṣẹ jẹ báyìí ẹ̀yà àgbàlagbà ní àgbà kì í wà lọ́jà kí orí ọmọ tuntun kó wọ́ ọ̀rọ̀ tí àwọn Treasure Kid Foundation tó gbé wá sí local government wa yìí àǹfààní ńlá ló jẹ́ fún wa ní Ìgàndò Ìkọ̀tún alága dẹ̀ ní ká kí ẹni tó jẹ́ founder this Treasure Kid Foundation wípé ọkù iṣẹ́ takuntakun inú wa dùn láti bá yí da òwò pọ̀ kẹ́ jíṣẹ́ fún ẹni tó jẹ́ foundation leader tíìmù yìí wípé alága ní ká sọ pé àwọn fẹ́ bá yí da òwò pọ̀ ìrànlọ́wọ́ tẹ́ bá need tá a fi máa join together láti make sure pé atákù menace tí à ń sọ̀rọ̀ nípa èyí ẹ wá rí ẹlẹ́ẹ̀kejì alága wo òfin ọ̀rọ̀ ẹ̀ ti ṣeré o wọ́n ní amúkun ẹrù ẹ wọ́ onókè lẹ́wọ̀ ẹ wo ìsàlẹ̀ gbogbo 7 ward ta ní níbí la ní primary health center tẹ́ pé ká sọ fáwọn aláboyún akọ́ máa lọ ìjọba náwó síbẹ̀ àwọn èèyàn wò kí fẹ́ jáde á ní ọmọ ń waste time àwọn health center ìjọba náwó síbẹ̀ nítorí kì í ṣe nítorí ẹranko torí àwọn èèyàn wa ní baálé ọkọ̀ láti gbogbo àgbàlagbà tá a bá rí aláboyún láwùjọ ìyálọ́jà ti lọ béèyàn bá lóyún nínú ọjà ẹ jẹ́ kó máa lọ sí kílíníìkì déédéé ọ̀nà àti kékeré láti ń pe ẹ̀ka àrókò tó bá dàgbà tán gbogbo àǹfààní wọ̀nyí ló wà nílẹ̀ fún wa ìjọba òfòwò ẹ̀ ti ṣeré ní Ìgàndò Ìkọ̀tún senior comrade Lasisi Ayinde Akínsànyà ibùdókọ̀ ní Lagos state tó gbé program kan wọ̀ recent the whole of Alimosho amẹ́sọ̀ pa àgbà sí Ìgàndò Ìkọ̀tún ó fà 5,000 èèyàn ló benefit ó fà 5,000 ẹ̀dẹ̀ lè testify sí ẹjọ́ eléyìí náà ẹ jẹ́ ká láti bí aláboyún ni ọ̀rọ̀ yìí ti ń ṣẹlẹ̀ o ká kíyèsára o ẹni tó bá ti lóyún ó gbóyún ni o ẹ má ẹ̀ka ta wọ́n nù kó máa lọ fún medical check up kó máa lọ kó máa rojú wípé time tó máa waste lọ́hùn yẹ tó bá nǹkan tó a fi máa dènà àwọn ìdààmú wọ̀nyí nìyí à ní dààmú lórí ọmọ o à ní dààmú ẹjọ́ lè jẹ́ message alága ní ká pass fún gbogbo wa a lot of ètò ìlera ló wà tá à ń ṣe ní Ìgàndò Ìkọ̀tún lọ́fẹ̀ẹ́ ibùdó ìlera Èkó yìí náà a tún rẹ́jísà fáwọn èèyàn lọ́fẹ̀ẹ́ ẹ jẹ́ ká máa yọ̀dí ẹ má kàn tìdí mọ́lé torí a tún ń bẹ̀ yìí abẹ̀ yìí ní orúkọ alága wa ẹ má tìdí mọ́lé o ẹ jẹ́ ká máa gbà wọ́n yẹn wa níyànjú a lot of people complain about the general hospital they never been there Yorùbá ló máa ṣàdúrà bọ́ lọ́wọ́ ẹ̀ka ọ̀rọ̀ general hospital ṣé lọ́kọ́ náà kọ́ fún ni ẹ jọ nítorí Ọlọ́run ó ti wà improve ẹ jọ Ọlọ́run ràn wá lọ́wọ́ ẹ ṣeun gan.
ẹ ṣeun sà adúpẹ́ lọ́wọ́ yín fún ìmọ̀ràn yín àti ìfọwọ́sowọ́pọ̀ yín pẹ̀lú Treasure Kids Foundation wọ́n dẹ̀ ti fún wa ní nọ́mbà wọn àwa ṣé gbogbo wa la ti gba nọ́mbà yẹn ṣé gbogbo wa la kọ nọ́mbà ok so ẹ jẹ́ a pè wọ́n tàbá nílò ìrànlọ́wọ́ wọ́n ti ní wọ́n máa mú wa dọ́dọ̀ alága ara ìdí tí a fi wà ń bí náà nìyẹn lẹ́ẹ̀kan sí ẹ bá wa appreciate aṣojú alága ìjọba ìbílẹ̀ Ìgàndò Ìkọ̀tún fún ọ̀rọ̀ tán ti bá wa sọ yẹn. Now please we are going to pause a bit before we continue. We have an award here that we want to present to the founder of this foundation, and permit me to call forward Mr. Mike. Is the one to coordinate this section. Thank you very much, sir.
Thank you, sir. Please let's achieve this so that we are closing very soon, so that we will solve the issue of this heat. Sorry again, but we also want to appreciate the chairman for making this possible. Yesterday we had a very, very big issue, and its chairman resolved it almost immediately. Please help us to clap for the chairman. This will have been difficult achieving it today. So a lifetime award is presented today by the TKF Nigeria team to a much deserving person, the Kalejaye family. Please, I would like to call Elder Kalejaye, sir, to come and receive this while I invite the Nigeria lead of the TKF, Mr. Michael, to come and present. Country Director, sir. Please, sir. This is the father of the founder, and he will be receiving it on behalf of the Kalejaye family. I will also invite another father. No, there are two fathers here. The two fathers of the founder, both the wife and the husband, they are here. So this is the father of the husband, and the father of the wife is also here. But they have decided that the father of the husband should receive this award on behalf of the family.
Okay, on behalf of Treasure Kids Foundation, the Kalejaye's family, for what they've been doing and what they have done to set up this kind of team and this kind of works. We want to say we recognize it and we appreciate them for this effort. Thank you, sir.
Please, let's appreciate the founder.
Please, Daddy, sir, can you join them, sir? Elder Uyeneko, please join. That, and he is the father to the wife. Both of them, they are here receiving the award on behalf of their children. Thank you very much, sir. And before he leaves, Elder Uyeneko, please join. He has something to say. And he has something to say. He said, I don't know that the work my children are doing is to this extent. And because of that, I want to do something. So, sir, over to you, sir.
A kí àwọn bàbá wa lórí ìjókòó balẹ̀ wọ́n kí o gbogbo àwọn chairman tó wà lórí ìjókòó a kí gbogbo yín o. Ìgbà tí mo gbọ́ nípa foundation yìí èmi rò pé bóyá àwọn nǹkan kéékèèké ni òun lè mí pè because nígbà tí wọ́n bí ọmọ tí arábìnrin yẹn sọ̀rọ̀ lórí ẹ̀ mo wà ní ọ̀dọ̀ wọn. I happen to be kí n sọ pé hospital tán ti bí ọmọ yẹn ibẹ̀ gangan ni mo ti ń ṣiṣẹ́ ńgbà yẹn so ojoojúmọ́ ni máa ń lọ wo ọmọ yẹn if táwọn ogun ọba sí mbẹ̀ mo ṣàrí pé improvement ń wà lójoojúmọ́. Nǹkan tí mò ń sọ ni wípé since a ò dẹ̀ nírú àǹfààní tó pọ̀ ńbẹ̀ yẹn ní Nàìjíríà bí báyìí bóyá ẹni tó bá ní 50 naira ẹni tó bá ní 40 naira ẹni tó bá ní 100 naira bóyá tá a bá dájọ́ àwọn kọ̀ọ̀kan wà tí a lè fi ṣe láti ran ẹwọ́rú arábìnrin tó sọ̀rọ̀ nípa oògùn yẹn tá a lè fi ràn wọ́n lọ́wọ́. Fún eléyìí tèmi náà lè ti rí màá bá àwọn foundation yẹn sọ̀rọ̀ iye tí èmi àti ìyàwó mi bá máa fi ránṣẹ́ sí wọn ní oṣooṣù so kí ètò yìí kó lè tẹ̀síwájú kí ó lè rí bí a ṣe ń fẹ́ láti máa ran àwọn èèyàn wa lọ́wọ́ dédé. Ẹ ṣé púpọ̀.
Ẹ jọ̀wọ́ ẹ bá wa ṣá wọn látẹ̀wọ́ tó rinlẹ̀. Ẹ bá wa ṣá wọn látẹ̀wọ́ tó rinlẹ̀. Ẹ ṣeun lọ́pọ̀lọpọ̀ sà. A dúpẹ́ lọ́wọ́ yín fún ìrànlọ́wọ́ àti ìtìnílẹ́yìn yín fún Treasure Kids Foundation. A gbàdúrà pé àpótí ẹ ti mú àwọn owó wọ̀nyí jáde lágbára Ọlọ́run àgbà náà ní wọbẹ̀. Ẹ ṣeun sà, a dúpẹ́. Now we continue with the panel section. We just have maybe 1 or 2 people to round up. Now a representative from the community health practitioners. Now we'll be calling forward the Ogata Patapata for Alimosho in person of my father and also my boss also to come and give us their contribution as well. Community health practitioners, you are welcome, sir. Community health.
Sir. Good afternoon, all. Yeah, on behalf of Community Health Practitioner in Alimosho local government, you all know our major job is within the community. We go out almost every day, but consistently on every Wednesday, to do what is called outreach services. Where cases like this could be felt or could be seen, and we believe with this little knowledge we have acquired today, we'll be able to assist more of them, at least show them where they can go to get assistance. And the little we can do too, we believe, with God on our support, they will surely get a better care. And not that alone, I will also synthesize my staff, my colleagues in the office, at least to look out for all these vulnerable children, and also for us to find a way of assisting them. We are government staff. We cannot pledge anything. We can only pledge our services as at when due. That's the only thing we can pledge. We cannot pledge financial obligations for them, but we can pledge our services. And I know by God's grace, we will surely do more in our own capacity. Thank you very much.
Please kindly appreciate him for that beautiful contribution. Networking them to where they will get services is very, very important as well. And also when they get to where they are going to get services, we have some people to attend to them as well. And through this, permit me to call forward a pest nurse to come and tell us, whenever they come, how they are going to give the support, so that they can be attended to on time and leave the health facilities in their location whenever they go there, so that there won't be issue of being delayed and waiting, or being at the waiting room for hours, and before you know, they will just come and leave. So with this, I'll be calling forward our apex nurse for Igode Kotun in person of Mrs. Ajayi to come and lend our voice to Treasure Keys Foundation for their own contribution. Thank you very much, ma. Please, let's appreciate her.
Good afternoon, all. All protocol duly observed. Thank you for coming, and God will honor every one of you in Jesus' name. Our contribution will start from our antenatal care. We will take our time to concentrate and take more time to attend to our patients. And we will make them our friends so that they can open up to us. Because some of them, they are going through a lot. A mother that has not eaten may not be able to produce a well-developed child. So we are going to take our time to find out psychologically, to read their mind, to know what they are going through, even at home. Or somebody that has been beaten by the husband, coming to the health facility, may not be able to give you a lot of information. So we probe into their condition so that we know what they are going through. Then, with what I've learned today, I'll go back to my facility and have meeting with all my staffs. They've trained me, I'll be a trainer too. I will train them. I will let them know what is going on. Then, even at my church, I will have meetings with all the women that this is what is going on. They should bring out kids with this type of condition. They are our children. We need to show them love. We need to have passion for them. So I myself am also a member of Treasure Keys Foundation as from today. The mothers that are here, we have a lot of responsibility to carry out. These children, they are created by God, and there is nothing we can do about it. We have to show them love. Let them know that this problem is our problem. It's not their own problem alone. It is a community problem. So every one of us, we have a lot of work to do. We need to support them. It's not giving money alone that you can use to support a mother. Telling them that, madam, how are you? How are you doing? How are you? Chatting with them is something. It relieves them of their pains. So please, let every one of us take up our responsibility at our various community, at our various places of work, at home, to show them that we really love them. And the problem is not their problem alone, it is our problem. Showing them love, having passion for them, it will go a long way, and it will relieve them of that burden. And let them know that we have schools that take care of these children. They should not keep them at home. Sometimes ago, my husband's colleagues in the office, the child was inside the room. And do you believe that the child came out and said, do you know what the child told my husband when my husband visited them? The child told my husband that the father asked him to put hand on an electrical wire. They want to eliminate that boy. That he put his hand and the thing shook him. Do you know that type of thing? I'm sure the parents, they are fed up. They want the boy to go, but God is God. God still kept the boy. And the boy is doing well now. So we have a lot of work to do at our various ends. And God will help us in Jesus' name. As for me, I'm a member of Treasures Kid Foundation. Thank you.
Please, let's appreciate our mother for that beautiful contribution as well. We thank you. Treasure Kids Foundation, you are having ambassador now. So please take note of that. Now, moving forward, as we all know, if they are not coming to the health facility for service delivery, surely they will have somewhere else they will be going to. So this will give us an insight to call. We have here the traditional birth attendants, BBO, BBO, Wiwe, Amaju Ashe. So we need one of their members also to come and give us, lend their voice to how they can also contribute. If they will come to them, what are the things they are going to do? Your representative. So permit me to call forward Mr. Ogunjimi, the TBA chairman for Ali Mosho, to come and lend his voice. Thank you very much, sir.
BBO, a point of correction, I'm not the chairman, I'm the Secretary General for the TBA Lagos State as a whole. All protocol duly observed. On behalf of my colleagues, TBA, we are the gatekeeper. We are very, very close to the community. And we have been doing our best. The TBA is not like on before, in the olden days TBA. We are not the olden days TBA. We are modern TBA. And we have been practicing it, and we will continue to. You see, we really thank our governor before Fashola, then Sanwo-Olu, all of them. They really did a best. We have been in partnership with all the tertiary hospitals. Whenever we have any challenges, we do refer to them. And láyé òsì táwa ìyá ti gbà pé kò ń ṣe àǹjọ̀nú tàbí rúmọlẹ̀ àbóṣà kan ló ń jẹ́ kí àwọn ọmọ ní problem. And mo tún fẹ́ sọ fún wa pé problem nìkan problem gbogbo wa ló yẹ kí ó jọ jẹ́. Now gbogbo àwọn nǹkan tó ń fa stigmatization tá a máa ń sá fáwọn ọmọ yẹn pé èmi kàn fẹ́ rọ̀ ẹ má jẹ́ kó rí bẹ́ẹ̀ mọ́. Ní facility ẹnìkọ̀ọ̀kan wa tá a jẹ́ TBA àwa máa ń kó wọn mọ́ra èyí tá a bá ti rí tágbára wa àmà sọ pé ọ̀ya ẹ lọ sí ibi báyìí. So mo tún fẹ́ ra gbogbo àwọn baálẹ̀ wa àwọn aráàlú gbogbo wa we are all gatekeepers. Ṣẹlẹ̀ wọn máa wá bá wa báwo la ṣe fẹ́ bá wọn sọ̀rọ̀ irú ìmọ̀ràn wo la fẹ́ gbà wọ́n. So tí irú challenges bá dé ẹ jẹ́ ká dúró tì wọ́n. Ó lè owó kọ́ ni gbogbo ẹ̀ ó lè má jẹ́ òbá moment báyìí tó bá lọ irú Dr. Adegboye àtọ́ kúrò níbí. If you have anybody with challenges I do direct to them and immediately I call him, then he will attend to the person. So Oluwaranwalo, then to the treasure kid. Mo fẹ́ lè sọ pé dídé wọn ọwọ́ mi náà ni wọ́n dé sí lágbàjọ through Dr. Adegboyega àti àwọn tí wọ́n ń ṣe anchor program. So we really and then we are promising to back them up like báyẹn ṣe fún gbogbo àwọn other NGOs tó ti wá like Wari, Afada and so on. So Oluwaran gbogbo wa lọ́wọ́.
foundation yìí lágbára ọlọ́run kò ní dúró síbi tó dé, á túbọ̀ máa tẹ̀síwájú. Bíbí o.
Ẹ ṣeun lọ́pọ̀lọpọ̀ sà, á dúpẹ́ lọ́wọ́ yín fún ọ̀rọ̀ pàtàkì tí ẹ ti bá wa sọ yẹn, lágbára ọlọ́run à á sì mú lò. Now to wrap it up, I will be calling on the President for National Youth Council of Nigeria in person of Mr. Mustafa to come and lend their voice also in terms of what the youth will also contribute as an ambassador for Treasure Keys Foundation. Thank you very much, sir. Please, let's appreciate him.
Good afternoon, everyone. I greet our fathers, our mothers, and everyone present for this very great program. And I'm doing shout out to all our kids out there. I pray Almighty continue to be with every one of us and see them through their sojourn in life. Mo kí àwọn bàbá wa, àwọn ìyá wa, ẹ ṣé gidi gan fún àǹfààní tẹ́ fún wa yìí. Àkọ́kọ́ kí n correct a little mistake látọ̀dọ̀ Gawa. I'm not the president. National no Martin Lo president. Ìpínlẹ̀ la wà, so coordinator la máa ń lò ní ìpínlẹ̀, pé coordinator National Youth Council of Nigeria, Igando Ikotun local branch. Thank you very much, sir. My name is Muhammad Mustafa Adesukomi. Before now, we've engaged the Treasure Kids Foundation, and on that first day, I really appreciate their concept, their initiative, and promising them that National Youth Council, not just me, National Youth Council Igando Ikotun is pledging their support as a bona fide ambassador of Treasure Kids. Two is that we want to work together on the issue of advocacy. A rí pé lára àwọn nǹkan tí ó máa jẹ́ kí àwọn nǹkan tá à ń ṣe yìí kó dé tí gbọ́ àwọn èèyàn dáadáa, especially àwọn ọ̀dọ́ bíi tiwa báyìí. Ẹ máa rí pé fóònù tí mo gbé dání òun ni gbogbo ọ̀dọ́ máa ń tẹjú mọ́ nísìn. Tó dẹ̀ yẹ pé programs tó ń lọ yìí gan, tá bá ṣe ń parí bíbí, a ti ń gbé sí orí àwọn phones wa, tó yẹ pé àwọn youth wa náà máa ní àǹfààní sí lórí Facebook ni, lórí Instagram ni, lórí Twitter ni, gbogbo àwọn handles yìí ni National Youth Council Igando Ikotun tí a cover. Àwọn yẹn náà a máa tún máa ràn yín lọ́wọ́ lórí ẹ̀ láti bá yín tàn ká sí àyíká wa. Also, we want to give our support on better collaboration with Treasure Kids. National Youth Council, being the umbrella body for all youth organizations, what we do mostly is service to humanity. And I'm promising you, anytime you call on us for maybe you have an outreach program, or you need a volunteer, you need volunteers for any of your program, you can reach out to us and we pledge our support to help in doing that. Just call on us and we'll be there to volunteer and assist you. It's a very nice initiative. I'm bringing it down to this, our local, Igando Ikotun. Thank you very much. God bless you. God bless every one of us here. Ẹ ṣé gidi gan, Olúwa wà pẹ̀lú wa.
Thank you very much, the coordinator for the coordinator. Thank you very much. We appreciate you for also lending your voice in this panel section. Sorry, the panel section ought to have been something we will arrange chairs here and we call out, but in order to save our time, that is why we do it in form of dialogue. So please, we are so sorry for that. Now, in order to wrap this section up, we have in our midst the Disease Surveillance and Notification Officer for Alimosho local government in person of Mr. Kindele. He is very, very used to this and is also going to lend his voice concerning this children with congenital and genetic disorder.
Thank you very much. All protocol be observed, the peace and blessing of God being upon everybody. So I want to say I am Akindele AA, Disease Surveillance and Notification Officer. I notice this type of conditions normally comes to informed through the community, either the health practitioner or the community like the TBA, the patent medicine vendor, and other people in the community. They look for what we call active case, active flaccid paralysis, active flaccid paralysis, the weakness of any of the limbs in children under 15. And when we look at these cases, we notice that not all are true AFP. Because we have true AFP and false AFP. The true one is the one that WHO investigate and will carry the stool to the lab. But the first one, which is, we have what we call rejected one. The rejected one are these conditions. And when we normally ask from the patient or the mother, this, from what they explain is what the pediatrician has explained, and all my doctors have stand here to explain. One, delay in labor. Sometimes it may be after delay in labor, sometimes confusion and other causes that the pediatrician has mentioned. And on the long run, they will do what we call blood transfusion when for medical care. In this case, when we see the type of case, you know WHO is basically looking for infection that is caused by poliomyelitis. In this case, when we have seen Treasure Kid Foundation, I will be able to direct this case. What I just need is to give me the contact number of this Treasure Kit so that when we have this case, we can direct us to their office for any action. Thank you very much.
Thank you very much, sir. Let's appreciate our DSNO for that beautiful contribution as well. Now, calling forward also Mrs. Ajayi, one of our beneficiaries here, to come and lend her voice as well, your contribution as well. Ms. Ajayi, oh, thank you very much, ma'am. Please, let's appreciate her.
Thank you, sir. Good afternoon, everybody. I'm happy to be here, and I'm one of the beneficiaries of this Treasure Kids. I will just have two contributions. Number one, I will just mention a little about my experience, then the advice to my other fellow people here. It's happened that I had twins when I was about to deliver, and immediately the doctor let me realize that the second one will be having a little issue, that I should not get so worried. But the baby looked very fine, so I didn't see anything until it was the time to start sitting down, do this thing. But one thing that I can just give as an advice, that when you have a problem like that, my own advice is that first of all, just acknowledge your God, your creator. Tell everything to him. That was what I did. And I give God all the glory today. The second thing is that there will be wrong advice here and there. I was having people around me giving me advice. Before I even started this, I was supposed to appreciate God in the life of the Treasure Kids, because they really try for us to. I have my sister here that's not this baby. She's sitting at the back there. she really supported me. So one needs a good people around them when we are in this type of problem. And seeing us today is not that I'm a rich person or that my family is rich, but it is by the grace of God. First thing that I did not do, people were giving me wrong advice that I should go for this app or not, but I've not been used to it. I'm happy to be a pastor's daughter. So I don't have experience of that. So when they bring this, I rejected this. And that thing has helped a lot. Because I have somebody that was in the same shoe with me that do go about doing all this about something. And the child died at last. So I will just, I'm not condemning for those people that are used to it, but I didn't use it. And God really helped me. Then another thing, let me just try to tell you what you will do when you have somebody like that. Number one, you have to encourage yourself. Don't give up. I did not give up. I never see her as Down syndrome. When doctor or anybody tell me that this is Down syndrome, I say my child is not Down syndrome. So you can confess good things to your life. And I always believe that she will read as others are reading. That's why the fact that the twin sister is alive, doing well, even she has married. If you see them, you will not know that they are twins. But I'm thanking God for the life of Taiwo. One of his father is here. What I know about them, like people to love them. So when you are in this type of situation, try to love your child, whatever may be his or her situation. Try to give them love. They like people giving them love. They don't want people around them to look down on them. So never look down on your child when you have this type of situation. And another thing, you should try as much as possible to get them secured. Many a times, people want to abuse her. I will not even give that room. Because even some Marua people know me. When I enter Marua at times, they will tell me, Omo Yineda, wherever I'm going, we go together. And I did not even believe that she cannot read. I tried all possible, but by the grace of God, and even to the extent that I took her to Oyo Special. Even I left her there, and by the time she came back, in fact, she's not the same again. And another thing, I think I jotted something down, that this type of children need is that you should not pamper them, but make sure you take good care of them. If you pamper them, that is another problem. My husband used to treat her when he was alive like other children. If you have a challenge person like that, if you pamper them, they can turn to a thief, turn to anything. Just love them, take care of them, and never pamper them. That is so, but I think my time is up. So,
please, let's appreciate her. Let's appreciate her, please. She has given us some salient point. Mothers in the house, can you get that? Please show them love. That is very key. Secure them. And the third one is what? Don't pamper them. Please, let's appreciate her again. Thank you, ma, for that contribution as well. And also sharing your experience with us. Now, to wrap this up finally, I will be calling forward the Directorate Medical Officer of Health for Alimosho local government in a person of Dr. Abimbola Adekoya to please come to the podium and come and lend her voice also in this section. Please, let's appreciate her. Thank you very much, ma'am.
Good afternoon, all. I would want to stand on existing protocol. Mafe mix. In all of this, I've seen that we should go back, create more awareness, do more advocacy, and support all our mothers. Not only the mothers having this challenge, but we should support ourselves generally as women. Because if we look at it from that angle, we'll be able to broaden our scope, and we will not see, okay, ọmọlágbájá ni kò ń ṣọmọ mi, so kẹ́niyẹn máa face warranty. But nǹkan tí mo fẹ́ sọ fún our mothers, all the mothers sitting behind, please, I want you to clap for yourself. Please, all the audience, please help me clap for them, because the work they are doing is not a joking issue at all. I want to tell us, we all know, even to raise other children, we know what it takes. Now that they have to raise these special breeds, we want to appreciate them more. We are praying for more strength for you, and by God's grace, issue àwọn ọmọdé àtàwọn yìí tó kù náà ó máa jiná fún yín jẹ o, ẹ ní ṣe lásán o, wọn ò ní ṣàìsàn fún yín, ṣé wá rí owó tẹ́ máa fi tọ́jú wọn, Ọlọ́run máa pèsè fún yín lọ́nà àrà lọ́nà bí tẹ́ ẹ fojú sí, ní orúkọ Jésù ní àgbàdúrà, àmín.
Please kindly appreciate my pastor, Dr. MOH for Alimosho local government. Thank you very much, ma, for giving us that beautiful contribution and prayer in order to wrap this section up. We appreciate all the stakeholders that have lent their voice in this section, and also we pray that for the mothers, by the grace of God, iṣu ọmọ àjìnà fún yín jẹ o, lọ́jọ́ ayọ̀ gbogbo àwọn ọmọ wọ̀nyí àníwá yín tì o. So we appreciate everyone. Please, let's appreciate ourselves for that beautiful contribution. Now, please permit me to use this opportunity to create awareness for an upcoming program we are having throughout Lagos State. We call it Integrated Supplementary Immunization Activities. It is called SIA. And this program is coming up on the 19th on the 19th of October to 2nd of November. And what are those things we will be benefiting as mothers and individuals in this program? We have oral polio vaccination for all our children from age 0 to under 5. So mothers, please kindly bring out our words during this immunization section so that our children can benefit. Also, there will be measles vaccination also during this campaign for 9 to 59 months for all our children. Both sexes are involved. And also for our female children, we have human papilloma virus vaccination also that will be coming up during this SIA, majorly for all our female girls, our girl child, in order to save them against cervical cancer. And also, we may be looking at it that everything he has been saying is just for children. How about we the adults? Okay, well, for the adults, we are having a package also for you. So for everyone from 9 months to 44 years, both male and female, we'll be having yellow fever vaccination as well. From 9 to 44. Baba Oshibelu is asking me, I'm more than 44 years, so please, let's be the advocate, or let's be the ambassador in order to inform all our people. We all know the importance of yellow fever vaccination for everyone. So now we are increasing the age to 44 years. So, and we know the importance of that card also. So, therefore, let's inform our people at home, please. Ẹ̀yin bàbá wa, ẹ̀yin ọkọ Olúwa ẹ jọ̀ọ́, ẹ bá wa sọ fáwọn èèyàn wa, ẹ̀yin pastor wa, ẹ bá wa sọ ní church, ẹ̀yin àfáà wa, ẹ̀yin CDC wí o, ẹ bá wa sọ láwọn meeting àti nínú ìlú wa kọ̀ọ̀kan kí gbogbo àwọn èèyàn lè mọ̀ wípé ìjọba ti ṣàwọn ètò yìí fún wa kí a lè jàǹfààní ẹ̀. Mo dẹ̀ fẹ́ kí a mọ̀ wípé ìjọba ìpínlẹ̀ Èkó nìkan ni wọ́n ti fẹ́ ṣe gbogbo eléyìí ní ìpele 5 tí mo ti dárúkọ. A tún máa fún gbogbo àwọn ọmọ wa náà lábẹ́rẹ́ àjẹsára. So ìjọba Èkó òun láti fẹ́ fáwọn ọmọ wa ní OPV, HPV, measles vaccine and yellow fever àtàbẹ́rẹ́ àjẹsára fún gbogbo àwọn ọmọ wa tí wọn ò lórí ọ̀fẹ́ àti máa gbá àwọn ọmọ wọn wá sí center. So ẹ jẹ́ a lo àǹfààní yìí. Mo dẹ̀ ti sọ tẹ́lẹ̀ a máa bẹ̀rẹ̀ ní October 19 sí 2nd of November. Nítorí ìdí èyí à ń sọ eléyìí náà ni kó lè di mímọ̀ fún wa. Ẹ ṣeun lọ́pọ̀lọpọ̀, a dúpẹ́ lọ́wọ́ yín. Ní báyìí a ti ń parí náà nìyẹn. Please, I'm calling forward now. We are in item number 17, and that is the closing remark. So, Mr. Mike will be coming forward to give the closing remark. Thank you.
That's Mr. Mike and Babatunde. Thank you. All right, we have 2 levels of closing remarks. Thank you first. Before I do the closing remarks for the conference and the closing remark for TKF, I'd like to invite Dr. Momo. She thought I forgot. She's going to give a goodwill message and closing remark also. She's going to speak into this conference. Then I will do the closing. Thank you very much. Please clap for her. Clap for her. She is MOH of Igondo Ikotu. I tell you, she has been helpful in this journey, and I told her she's going to do this.
Good afternoon, everybody. Okay, we want to appreciate everyone here for this conference. We really appreciate you all. We bring greetings from our local government chairman, though he has a representative here, and also greetings from the supervisor for health. He sent his greeting. He's presently in another meeting. That's why he's not here. So they've really said a lot concerning the program. So I don't need to start talking about congenital defects and children that are vulnerable. I, for one, I actually have a first-hand experience about a child. I have a nephew that actually has hydrocephalus. So I can feel it. Even when the mothers were talking about the cost and everything, I could imagine what they were saying because it's something I have gone through. I don't want, let me not start with finished, but it's something I have a first-hand experience about. So for the mothers, I want to encourage all of you. I know what you are going through. Then I also want to employ on the fathers because we really do not have the support of the husbands. So please, I want to reach out to all fathers to assist the mothers when they are going through things like this. It's really not easy. But I only pray that it's only God that can help them to go through the phase of bringing up a child that has one deformity or the other. Then I also employ all other stakeholders to help reach out to every other person in the community so that we can reach out to more of them and see how we can help. From what the PS said, she said something about Lashma. There's a platform where we can reach out to the vulnerable. So if we can get them through the help of this our Ilera Eco that is ongoing, we can be able to register as many of them and see how we can help them so that they can get the best of care. So on this note, I want to thank you all for coming, and we wish you safe journey back to your homes. And we also pray that you should pass the message to those in the community so that we can give them a helping hand. Thank you so much.
What you don't know, and that's what this conference is all about. We have had a lot and a lot have been said. We want to say thank you to all participants, all the personnel. Thank you, all the volunteers. Thank you for making this a success. Thank you, CDAs. Thank you, TBAs. Thank you, our chiefs and high chiefs. Thank you, our parents. Thank you, the guardians. Thank you, our chairman, representative, everybody, TBAs, our youth leaders. Thank you, Apex Nurse. Thank you, all the nurses. Thank you, all the medical personnel. Thank you, all the MOHs. Thank you, everybody. Thank you, parents. Thank you, guardians. Again, please, a round of applause to all of our mothers who came. And she said it. What about our fathers? But we have a father here with us, or a father brought. So a father brought. Please, father, stand up. Let them see that a man is represented. A man came, a man came, a man came, a man came. Thank you again. As we bring to a close this maiden edition of the conference, we remember the wisdom of the African proverb. It takes a village to raise a child. For children with special needs, this village is more crucial than ever. Together, let's build a community that is nothing without you, supporting and empowering everyone to be the change we want to see in the world. A community of change for children with congenital and genetic disorder. Remember, this change begins with one person, one action, and one choice. It begins with you. And we say again, we have said a lot. Sorry to say talk is cheap, but action. We want action. TKF is ready to go the extra mile with your support. And we want collaboration. We want to continue from the conference. We always say the work begins after the conference. We did so much to achieve the conference, but the actual work begins after the conference. To our mothers who are here, the work begins here. We are going to meet with them. Our programs are already stated. We mentioned it at the high stakeholder level. We are going to kickstart almost immediately. We'll be having a rapport with them. Like I mentioned, the first level is to have consultation with Dr. Adeboyega. Is ready. Almost immediately we are going to kickstart that. And from there we know what we'll start doing with all of the parents that are present here. Thank you very much for joining us today. So I'm going to end with this before I call the one who will be closing with us today in prayers. All of us remember that slogan, Abi? I think the MC did it very well. Raising a community of change with one. Raising a community of change with one. The last time, raising a community of change with one. On that note, I would like to invite Mrs. Ayenigba for the closing prayer. Thank you very much. Mrs. Ayenigba. I was told it's Pastor Mrs. Ayenigba, that I should call it properly. Thank you, ma.
Praise the Lord. Our Heavenly Father will return all the glory, honor, and adoration unto you. The God that created everyone, Baba, we appreciate you. We bless your name for this program. We thank you, Lord, for what you have used TK, oh Lord, in the community. Father, we appreciate you. Father, receive our thanksgiving in Jesus' name. We thank you because we started well and we are rounding it up well. Blessed be your name, Lord, in Jesus' name. We are moving out, Father. Let your presence go with us in the mighty name of Jesus. Lord, this vision will not die in Jesus' name. And all the children, oh Lord Jehovah, you lay your mighty hands upon them in Jesus' name. Divine healing from above in the mighty name of Jesus. I commit everyone's journey into your able hand, Father. We pray for mercy journey in the name of Jesus. Blessed be your name because you have answered our prayer. For in Jesus' powerful name I declare. Amen.
Thank you for the happiest year of my life. Ooh. Thank you for the happiest year of my life. Ooh. Best year of my life. Thank you for the happiest year of my life. Best year of my life. Thank you for the happiest year of my life. Ooh. Best year of my life. Thank you for the happiest year of my life. Ooh. Best year of my life. Thank you for the happiest year of my life. Best year of my life. Thank you for the happiest year of my life. Ooh. Best year of my life. Thank you for the happiest year of my life.